Being 4 o'clock, we are going to call this meeting to order. I know we do have some technical work happening in the back, but we'll let that happen. So, as we call the meeting to order, we recognize that Prince Albert is located within the Treaty 6 territory and is homeland of the Dakota and Métis. We extend our respect to all Indigenous people for valuable past and present contributions, and recognize and respect the cultural diversity within the city of Prince Albert. So we will move to the approval of the agenda. Now, before we move the approval of the agenda, there are 3 items that I will mention. The first is that we have a updated map on our desks, and I believe the city clerk will advise us on that.
We have a request from administration to replace the Schedule A priority snow route map with the map provided on your desks regarding item 7.2 of the agenda. The incorrect map was inadvertently attached to the report on the agenda.
Thank you. The next item to mention is if you could look at item 7.8, request for 2021 tax relief. We are suggesting that we move 7.8 up to be 7.1, the first report of administration, simply due to a scheduling conflict. So unless there are any issues with that. And the third item to discuss is what is currently listed as 7.1 is the airport terminal 33% preliminary design presentation. So we've been advised that this item is being presented by Prairie Architects and that the intention is to present the entirety of the PowerPoint that we saw in our packages, which means that it's proposed that this item not be limited to 5 minutes, that it would take perhaps 20 minutes or so. I believe that our architect is here ready to present. And so I've spoken to Mr. Hicks about this, and unless I hear any objections on that, okay, then I believe we could have a mover. And I'll advise that today is my first day with the new technology. So if we could please be patient, I will do my best. So I will... Mr. Mayor.
I do object.
Oh, yes.
Okay. Well, strictly, we have 1, 2, 3, 4 presentations as it is. And now we're going to have a long night, and we're told. So I am going to move the items, but I'm not going to agree to 20 minutes. So I'll move the items. I was going to move 7.8 ahead because we have guests here for that. But I'm not prepared for 20 minutes. So I don't know if you want me to withdraw my approval then, or?
Perhaps as the architect is here, could I propose that we ask for an abbreviated, perhaps more than 5, not keeping to 5 minutes, but perhaps less than 20 minutes that we ask for?
Well, I'd sooner talk to the director. The director invited the guest, should have informed the chair and the review committee how long he's going to make his presentation, and then we would have adjusted the schedule. But we adjusted the schedule because we want to hear the first 3 presentations, and they're here.
So I will perhaps ask if the director could speak on this.
Thank you. To the question from the mayor, I did inform the clerk's office. This is the same as with the event center or the aquatic center. This would be your first chance to see the architectural design, which is at 33% preliminary design. So it is a lengthy presentation to allow you to see where we are. If you wish to shorten it, I guess that's your prerogative, but our intent was to try to inform you of how we're proceeding and get your approval so that we can continue on with the detailed design.
I am going to, does the mayor want to speak to that specific issue? I will shift to the mayor.
And I agree with everything you said, but you should have planned with the planning committee the appropriate time for the presentation. You can't assume that we know, well, it's related to this one that took 10 minutes. So, you know, we see what's on our plate. So I'm actually going to withdraw my motion. I'm not going to agree to the 20 minutes.
Thank you, Councillor Head.
Thank you, Deputy Mayor. I will move the motion, and I do feel it's important that we listen to the presentation in its entirety. I know our procedure bylaw speaks to our meeting limits till 11 p.m. I hope we're not that far tonight, but it's important that we hear for all the information. So,
Thank you. Councillor Zurikowski, I'll turn to, if I can.
Second.
We are in committee, so I believe we just need the mover, but I appreciate the effort.
Let's go.
Then, hearing no further discussion, we will set the vote. Vote is open. And close the vote. Vote is carried and accepted. Next is declaration of conflict of interest. If you have any conflict of interest, please declare. Adoption of the minutes. Do we have a mover? Oh, I'm sorry. Yes, and so I will green. Councillor Edwards.
Oh, I don't have to stand. That's right. Thank you, Deputy Mayor. I will declare a conflict of interest for item 7.4, Carlton Park Club Pave the Way fundraiser. I am on the board of Carlton Park, and so I will withdraw myself from that conversation. Thank you.
Thank you. Adoption of the minutes. And Councillor Miller.
So moved, Madam Chair.
Open the vote. Vote is open, but we don't have all of our votes in. There we are. Carried and accepted. 5.1, social justice and advocacy in mental health. I see we have a presentation from second-year nursing students. We will ask you if you could go to the podium. We welcome you to our chamber, and we do ask that you keep to the 5 minutes on the timer.
Okay.
There you are.
Great. Thank you, Deputy Mayor. So good afternoon, everyone. My name is Amber Thomas, and we are a group of second-year nursing students from the University of Saskatchewan in Dr. June Annenson's class. Today, we're going to be talking to you about social justice and advocacy in mental health. We will highlight some stigmas and barriers, advocacy and education related to mental health. Mental health is an issue that is seen everywhere, including Prince Albert.
Thank you, Amber. My name is Jan Thomas, and my research focused a lot on reasons why people seek mental health care services in our community. We know social determinants of health impact how often and the likelihood of someone seeking mental health services throughout their life. Things like food scarcity, homelessness, inaccess to other healthcare services, and systematic inequalities directly impacts mental health in our community. Without having access to these necessities, our mental health services in Prince Albert will continue to be over capacity.
Hi, my name is Kennedy Allen. My research revolves around the stigma influencing the healthcare workers' attitudes towards mental health patients within the healthcare system. 2 studies had concluded that over half of the healthcare workers had implicit prejudices and stereotypes towards people with mental illness, and that over half of the doctors experienced mental health issues. These studies bring light to how prevalent stigma is towards mental illness and the mental health patients within the healthcare system. After going through the anti-stigma training, the healthcare workers were finally able to identify their prejudices, which made a huge impact on how they treated their mental health clients.
Hi, I'm Megan Picard. I focused on advocating for clients for my portion of the research. So advocating for our clients is a very important part of being a nurse in any healthcare environment, but it is especially important when we're dealing with mental health clients. There are times when clients will feel that they do not know how to advocate for themselves, as they often feel devalued, dismissed, and dehumanized by many of our healthcare professionals. As future nurses, it'll be our job to understand the client's needs because we have the power to help them receive optimal care.
Hi, I'm Tessa Sommerfeld-Riel, and the focus of my research emphasizes the benefits that come from teaching children directly about the organizations that are in place to help them, including the Youth Mental Health Canada, Kids Help Phone, and many others. Educating children of their basic rights limits misunderstandings, miscommunications, or missing out on those resources altogether. Knowledge is a powerful tool, and providing youth with the right information and healthy coping mechanisms gives them positive outlets to help improve their mental balance.
Hello, my name is Talon Romanchuk. To summarize what was said, it is important that mental health treatment is accessible to all. When patients are understood, advocated for, and educated, the result is a positive outcome for both the clients and the system. As the leaders of our community are putting together action plans to better the City of Prince Albert, they need to take into consideration the complexities of mental health. As much as healthcare individuals are trying to make it better, there are systematic barriers that are playing a great role into the outcome of our success in our mental health emergency services. We now ask if there are any questions.
Thank you very much for the presentation, and we will turn to the chamber for any questions or discussion. Councillor Ogrodnik.
Thank you, Deputy Mayor. Thank you to the students that presented today. It takes a lot of courage to stand up and speak your mind to in this chamber, and we appreciate your comments. I don't have a specific question, but it's just it's always reassuring every year when we have our nursing students come and remind us of some of the problems that we have in our community and the possible action plan that's in place. If we had the resources to do it, all of those action plans would be implemented. It takes 3 levels of government to work together, 4 levels, and all different governments to work together to implement what you're asking. And so I hope you present or lobby the provincial and federal governments as well to work with the City of Prince Albert in dealing with the issues that you raised today. And it's also good to see former students up there. Very happy, very proud teacher here.
Thank you for your comments.
Councillor Zurikowski.
Well, thank you to the second-year nursing students. Is that what we are? Second year? Perfect. So I'm curious if in your training, in your classes, if your practices during the day in your labs are continuing now without COVID restrictions. So I'm curious about that. And the question I have about your presentation is, in your research collectively, have you been able to identify any gaps in our community insofar as services to mental health?
Okay. There's 2 questions there. So I guess to point to if our studies are still going on with the COVID restrictions, there are some restrictions still in place. Right. So some of our assessments we're not able to do, but we're still doing a lot of hands-on practice to get ourselves ready for our nursing futures. To answer your question, your second question, our research is a little bit limited. There's not a lot of research for Prince Albert directly. Some of my research had to do with hospitals in Saskatoon, so we can look demographically, we would have some similarities. And there's just an overwhelming, there's overwhelming statistics to show that when people don't have the bare necessities of living, like those inequalities that we talked about, there's always going to be a mental health imbalance. So it's just something to be aware of. And we found that education was the biggest thing that we could do for everybody else in the community to impact that in a positive regard.
Thank you.
Councillor Head.
Thank you, Deputy Mayor. And thank you all for your presentation and your attendance here tonight. Very much appreciated hearing from you all, and congratulations on your field of work. Much needed in our society. I want to say, I really appreciate some of the words you had spoken, and I wrote down a few. I think it's important that we're mindful that having access to these mental health services is a necessity, and you've touched on that, and some of the systematic barriers, which you didn't quite go through, but I realize that there is a lot in our societies, and to reiterate some of the comments of my other counselor opposite, advocating at different levels of government is very important. So I look at some of the restrictions we have, and we're coming up to budget, and we do kind of look at some of these, this issue specifically around mental health and some of the services we're providing here in Prince Albert. I want to remind that we did pass a motion a couple weeks ago in our executive meeting to look at ways of bringing in a permanent solution, or at least around a 75 critical care center, which would include, I would hope, mental health services as well. So thank you all for being here today.
Councillor Edwards.
Thank you, Madam Chair. And thank you all for coming and presenting. It's very much appreciated, and it's so important to bring that awareness to mental health. I do have one question, and then I have a couple of comments, and you may or may not know this, but when you look at Prince Albert, do you feel that we lack more resources in comparison to other cities? Difficult question, I know, but.
We don't really have the answer to that, to be honest with you, but it's something that we'd be very interested in finding out more of.
Yeah, it's tough. I know the province is struggling right now with mental health, probably all of Canada. But it's a very complex issue, and one of you mentioned it's complexity, and it's such a complex issue to figure out what is going on with people and how to address the issues, but yet there's not enough time. People aren't given enough time. Our workers don't have the time to sit down and figure things out. They're running from patient to patient. So it comes down to lack of resources again, and that's the shame. And people's needs aren't getting brought forward and addressed in a timely manner before they, turn to substances or crime or, and that's where it's just a shame. And having people like yourself advocate for more services and awareness and education is so important. So thank you for coming out.
Thank you.
Mayor Dion.
Well, thank you for coming. I think one of the biggest challenges you have is I don't think the general public understands what mental health is. They think of the 5th floor, the 6th floor, jackets. They don't understand that mental health is in this room. That it's everywhere and it touches everyone. So I think when it comes to mental health, that's a big challenge. So thank you for taking it on, and I understand some of the questions you can't answer because it is such a vast issue. It even touches our homeless. Is it addiction, mental health, or homelessness? So there's lots of pictures out there. So I give you credit because one of the biggest challenges is mental health has really come to light, I guess, during COVID, because now it's more prevalent, because people now understood it more, and more people were affected by it. And so I give you all the credit in the world for tackling this, because it is a hard subject, and in lots of cases, it's a subject that no one wants to talk about. You're not talking about me, are you? But we all have our issues. Like COVID affected quite a few of us, and people don't understand it was mental health. It wasn't COVID that was affecting us. It was being locked up, not seeing our friends, our restrictions, we're getting crazy thoughts. That's mental health. So I congratulate you on coming, and thank you for that. And I'll move the recommendation.
Thank you. Any further discussion? Hearing none, we'll open the vote. Vote is open. Carries. Thank you for your presentation. You're welcome to stay or leave the chamber. 5.2, In technology, innovation and future nursing, and we again have some second-year nursing students we will welcome to the podium. And again, we'll ask to keep you to your 5 minutes on the timer.
Hello, my name is Mildred. I'm a second-year nursing student at the University of Saskatchewan. The topic of this presentation is technology and innovation in nursing. Okay. Technology and innovation plays a role in shaping history to be a reliable and truthful profession, as well as in protecting information in the healthcare system. This presentation explores the improvements of nursing through influential people like Florence Nightingale and associations like the Saskatchewan Registered Nurses Association. Thank you.
Hello, my name is Maria. I'm also a second-year nursing student. So with the help of technology, nursing has come a long way from its early stages. Like Mildred said, serving in the Crimean War, Florence Nightingale was one of many who have made a huge impact in nursing profession. She was renowned for implementing sanitary environment when treating wounded soldiers. With her knowledge, along with technology, now gives us a faster response time, improved our problem-solving skills, as well as a whole new level of comfort and support. Technology now also reduces anxiety, stress, and expenses not only for our patients, but also for us nurses.
Hi, my name is Angelina Addo, and my section revolves around the examples of technology. So some current technological innovations in the nursing field include the electronic health record, point-of-care technology, smart beds, electronic lift systems, automatic IV pumps, as well as patient and staff identification systems. These provide increased efficiency and ensure faster communication with team members, patient records, and reduce chances of nurse oversights and errors. As technology evolves, we're introduced to developments like telehealth, used by patients who are unable to attend healthcare facilities in person. And more controversial advancements include artificial intelligence to monitor patients for signs of dementia, robots that are capable of drawing patients' blood, care bots that can help patients move from beds to bathrooms or even stand, as well as robots that can help with nursing tasks and assign rooms to patients. Lastly, we have TAVI, which uses pre-recorded videos of nursing coaches to manage their health conditions and make behavioral changes. The patient simply logs into the system, answers the multiple choice questions, and TAVI uses an algorithm to choose which of the thousands of videos to play back. Thank you.
Good day, everyone. My name is Shanice, and I am also a second-year nursing student in University of Saskatchewan. Among all the technological advances in nursing, one could argue that big data is one of the most used in the healthcare setting. Healthcare big data simply refers to analyzing, collecting, and leveraging patient data, physical or clinical data that are too vast or too complex to be understood by the traditional means of data processing. As part of the profession whose mission is to provide optimal and holistic care to patients, nurses should be skeptical in allowing these innovations to have access to the client's sensitive data. In short, confidentiality is an implication of respecting clients' autonomy, which is one of the main principles in nursing ethics.
Hi, I'm Carmen. I'm a second-year nursing student as well, and I've come to talk about how nurses provide ethical care with the help of technology by incorporating 5 main principle standards into their practice, which are responsibility and accountability, knowledge-based practice, third being ethical practice by following the Canadian Nurses Association Code of Ethics for our ends, fourth is service to the public, and lastly, nurses must demonstrate self-regulation. An important example of technology today is in the everyday nursing practice is the electronic health record, EHR. There's many, but this is a common one. It allows for improved and efficient coordinated care and patient safety. Nurses spend less time documenting patient data, and because of EHR's built-in functions, and so organized patient information is readily available for clinicians and nurses to have access to whenever they need it, and it thus results in better coordinated and efficient care implementation for the patient.
and yes, patient safety. So yes, go ahead.
Hello, I'm Christian. I'm also a nursing student. So care as we currently know it would be much different without these technologies and the nurses' drive to bring about positive advances in their field. Along with other professions, new developments in treatments and specialized care has grown and advanced considerably. Nurses are one of the most trusted professions in the world, and so they'll continue to make efforts to be high in the public. And technology in nursing has evolved immensely, and with such a high demand for nursing care, it will continue to evolve. So we'll open it for questions.
Thank you very much. Any discussion? Councillor Kilmer.
Thank you very much, and thank you for your presentation, especially on technology and the idea bringing to light the technology is trying to ease the role of nurses and the time that nurses spend putting data in. And my one dream for all of you, and I see it in all of your faces, as well as the first group, is we can't forget the human part. And I know that the times that I've been in the hospital when I needed people the most, the nurses were the people and the connectors. And they made the lives easier of my grandparents and anybody that was in there. So I really appreciate you coming and presenting. I really appreciate the information on mental health and as well as technology. And I really look forward to what you guys are all going to bring, which is humanity to healthcare. So thank you very much.
Councillor Head.
Thank you, Deputy Mayor. Again, thank you all for your presentation, and it's really inspiring to see second-year students here talking about some of their tech sector and how that kind of intersects with our healthcare sector. I do want to note that we will be building a hospital in the coming years here, and I hope that we have the state-of-the-art equipment in our facility. So it's great to hear this this presentation on technology. Thank you very much.
Thank you. I'm looking for a motion. Councillor Kilmer.
I'll move.
Thank you. Any further discussion? We will move to the vote. Vote is open. Carried. Thank you so much for your presentation. I'm hearing from my colleagues the encouragement to stay in Prince Albert, and we'd love to have you. And you're welcome to stay further in chambers or exit if you wish. Thank you.
Thank you for your time.
Fi- 5.3. Restrictions on methadone dispensaries in zoning districts that permit drugstores. We have a verbal presentation. Welcome. Thank you for being here. And I am going to set the timer, and we just ask if you could try to keep to the 5 minutes. And welcome.
Thank you, Madam Chair, Mr. Mayor, and council members. My name is Amy Lamb. I'm a community pharmacist practicing in Prince Albert, registered with the Saskatchewan College of Pharmacy Professionals. I come here as a member of the pharmacy profession and representing the Indigenous Pharmacy Professionals of Canada as the organization's co-chair. I'm also acting as a representative on behalf of the vulnerable populations in Prince Albert as the chair of the YWCA Prince Albert. I'm addressing City Council to request an appeal of the City of Prince Albert zoning bylaw number 1 of 2019 pertaining to amendments made in 2018 by the City Council of Prince Albert regarding restrictions on methadone dispensaries in certain zoning districts. The intent today is to provide background on methadone and methadone-like substances for the treatment of opioid use disorder and to record to public record the accurate statistics regarding harm reduction services, as well as contest the legality of zoning bylaws as they restrict the scope of practice of pharmacies and the health rights of Canadians. The The City of Prince Albert accommodates not only our own community members with social disparities, but we serve as a place of refuge for our surrounding and northern communities as well. Creating barriers to supports for health and social crises of our vulnerable populations exposes these indignities directly upon our community members who serve them. Our teachers witness the destruction of untreated addictions in families, our healthcare systems become overwhelmed, and we see increasingly spreading violence upon innocent members of our community and those who serve to protect them. There are many misconceptions surrounding methadone use and the impact of methadone clinics on a community, including increased crime rates, healthcare costs, addiction rates, and illicit drug prevalence. In fact, the opposite of all of these points is true. The references provided in my letter for this meeting show the following: that the rate of violent and non-violent crimes reduces by 1/3 if a patient is stabilized on methadone. The annual cost to the healthcare system for someone who is on methadone is $6,000 versus $45,000 for untreated individuals, which does not factor in the costs associated with the preventative action of methadone of HIV rates, which can increase the cost of one individual up to $100,000 per person. Methadone use after 2 years has been shown to decrease hospitalization rates by 50% in these individuals. Methadone treatment during and after incarceration was associated with reduced illicit opioid use, reduced reincarceration rates, and most importantly, a greater likelihood of employment after 1 year. Adherence to methadone was associated with significantly lower rates of death in these individuals by overdose and actually all other cause mortality. I do call to question today the legality of these zoning bylaws based on the following. The zoning restrictions prohibit methadone dispensing in zoning areas permissible for drugstores, which supersedes the authority over the pharmacy profession's scope of practice by limiting and regulating the offering of methadone services, an authority only granted to the Saskatchewan College of Pharmacy Professionals in Saskatchewan. The Canada Health Act and the Health Charter for Canadians are federal initiatives that highlight the importance of accessibility. Accessibility means that insured health services should be provided on uniform terms and conditions, and that on a basis that does not impede or preclude reasonable access to those services. They also note a patient's right to freedom of choice in accessing care, and the present bylaws reduce accessibility and fundamentally eliminate the right to freedom of choice. The YWCA Prince Albert is a nonprofit organization that has a key understanding of the breadth of the health and social crises in this city. YWCA facilities have the capacity to house and support, as those nursing students indicated, these social determinants of health that are required to support mental health and addiction, but they can only do so for the semi-stabilized or stabilized patients on harm reduction therapies. They have limited facilities and resources to support individuals with untreated addictions. As the co-chair of the Indigenous Pharmacy Professionals of Canada, I represent the voices of Indigenous healthcare professionals, specifically those working in pharmacy practice. Indigenous people have poorer health on average than non-Indigenous populations and carry a disproportionate burden of the harms related to substance abuse, resulting from structural and systemic disadvantages caused by colonization. The United Nations Declaration on the Rights of Indigenous Peoples includes that Indigenous individuals have the right to access, without any discrimination, all social and health services. It may seem as though there's ample availability of methadone dispensaries in this city, but the reality and rationale behind our designed universal and accessible healthcare system is to recognize the nuanced environmental factors that impact health outcome and disease trajectory. Individuals seeking recovery must have every opportunity and support to succeed. This includes spaces that are readily available for the often daily witness dosing of this medication. A wide variety of available and accessible facilities reduces the risk of exposure to prejudice, lateral abusers, and increases opportunities for the care to be provided by clinicians whom they trust and respect. Any limitation or barrier, real or perceived, is a significant risk to the trajectory of addictions recovery. The aforementioned economic costs, increased crime and incarceration rates, and further traumatization of our youth, public service workers, and community members are what we have at value today.
Thank you very much for your presentation. I'll now ask for any questions of our speaker, Councillor Zurakowski.
Thank you for your presentation. A couple of questions, if I may. The methadone clinic, or sorry, the methadone program is part of addictions recovery. It's only one piece of that recovery program. Could you talk about where that fits in the recovery program?
absolutely. As part of a recovery program, sometimes we even refer to methadone as what's rapid action addiction medicine. So it is something that can be available before the institutionalized supports are available. There is certainly a very limited amount of beds involved for detox and other supports that are in this facility, in this city, as well as there's a limited amount of crisis and post-crisis beds available. And having worked in many clinics and many positions where we are working with methadone using patients, what happens is that you have a day-to-day interaction with a client, and so you're actually offering a lot of the supports and services from, say, a pharmacist or any other professional that's witnessing the administration of methadone, anything from referring them to social supports within the city, to providing them with access to mental health supports, to guiding them towards Narcotics Anonymous, Alcoholics Anonymous, or any other trauma-informed care supports. And so, ultimately, there is a very structured means of addressing addictions, but this is actually something that an individual can seek on their own with a practitioner. There is no longer limitations on the types of prescribers that can prescribe for methadone therapy, which was changed in early 2017. And essentially, you can go in to see any family practitioner and say, I've got a major issue, I need to deal with this, and we can help in the transition from illicit drug use into a stabilized methadone use, and then help in, either helping these individuals seek a YWCA facility to deal with their homelessness, other places where they can be better supported in those foundations for health.
Okay, thank you. That was a good answer. The lack of institutional supports in this community that you talked about, the pre and the post methadone phase, is there, I think you might have alluded to it, the length of time of the actual methadone period, on methadone for a period of time, number of weeks, has that changed? And is it because of a medical reason, or is it because of those lack of institutional supports insofar as what comes after the methadone program?
I think the intention is always for this program to have an endpoint. There is actually lots of patients that go down to almost a negligible level of a dose, weekly dispensing or biweekly dispensing, and they still stay on the therapy almost very long term, but they're extremely stabilized. I would consider, the end of something that would be an acute treatment program when that individual has been stabilized on a dose, when they are no longer actively seeking the illicit drug use, they are no longer sort of the whim and control of that addiction, and they're able to reintegrate back into jobs, into society. And so we see people still actively as using or as having methadone or methadone-like substances used for maintenance control, but they are well beyond the active addictions phases. What I was referring to, and in fact there is a very newly established program at our house, YWCA, is that there is a pre and post detox bed available, but it's like 6 seats. And then again, there's about a 2 to 3 month wait to get into detox. And, ultimately, people who are dealing with addictions, when they decide that I want to change, now's the day. 2 months from now might be far too late, not just for their willingness, but also for their safety.
Right. And those lack of detox beds, that's certainly an advocacy effort that we've been screaming and yelling about in this community. Is there's not enough, and that length of time before they kick somebody out is in fact too short.
Yeah, absolutely, absolutely. And so, this ends up being something that, especially offered through pharmacies, and this is where it was a little bit of a concern for me as a pharmacy professional, because when we talk about the accessibility and that open accessibility, pharmacists are allowed to provide methadone. And so when a patient comes to a pharmacy and they're told, I'm not allowed to give you methadone, that doesn't seem like it's sort of a fair or equitable, accessible service. You know, you're my neighborhood pharmacy. Why can't I just come here and get my medication just like I get my other medication? And ultimately, that neighborhood pharmacist might be the only healthcare professional that they trust, the only person who doesn't re-traumatize them. You know, I've seen in many circumstances, and I've even discussed, you know, the rationale behind having, you know, a women's only methadone clinic, because much of the lateral abuse that occurs is re-traumatizing individuals because they got to go, you know, stand in one of these lineups with 6 other individuals, and one of which might have been somebody who's been an abuser in the past and who has traumatized them to the point of seeking these kind of soothing mechanisms.
Yeah, and you make a good point. I certainly understand your perspective. I don't think anybody here is saying methadone program is wrong. It's not allowed in our community. That's certainly not what we're saying. I think what we've said before is methadone is an important piece of that recovery, how did you phrase it, of an institutional support moving along the continuum, the spectrum.
Yeah.
I think what we've tried to do is tell these businesses, because they're in it to make money and make a business, and provide a service as well, is ahead of time, before you open up your business, if you go into a neighborhood where there's residential, we have some trepidation about providing that service. Methadone is widely available in our community. There's how many clinics in the city, just for a fact check?
It's about 6,
Okay,
and
I was
it's,
gonna
and
say
I said, you know, primarily offered through pharmacies, you know, and then there is Access Place and other services that facilitate the care. But my argument to that would be, just based on the statistics that were presented here today in reducing crime by 1/3, we may perceive that those neighborhoods do not have active addictions in them, but those active addictions are occurring at nighttime, and, you know, your car's getting broken into because somebody is in active addiction. And I would argue that in not creating very accessible services, and, you know, there are patients who they're having to catch a cab every day, you know, with their kids in the back of the cab to get their methadone. They're spending the $10 on the cab to go to and fro. It's a huge barrier for them when they really, you know, the drug dealer just lives next door or in the building that they're staying in and stuff. And so, you know, that illicit drug use is occurring in every neighborhood, and the more adjacent and the more accessible that we can make that care, then we just reduce the likelihood of there being crime. And perhaps it is seen more in the daytime. You know, we're seeing these people coming in for 9 a.m. to get their medication, but they're already there. I really believe that.
Again, I certainly appreciate your sharing your passion, your perspective. I'm certainly not going to argue that. I respect that. If I was sitting in your chair, I'd be screaming and yelling too. But I'm sitting in this chair, and it's my responsibility to build a healthy community with the perspectives of those families and the people that live in that neighborhood.
Yeah, and, you know, I think it's important to draw back on, you know, who are our community members and what do they do from 9 to 5 or from 10 to 3 or over the night shift. And I mean, a huge proportion of our community members, whether or not it's occurring in their neighborhoods, it's occurring in their day-to-day lives, in their workplaces. Our public service workers are bringing home those traumas every day, regardless of whether or not it's walking down the street next to their homes.
Perfect. Thank you, Amy.
Yeah.
Thank you. Mayor Dion.
Well, thank you. I'll try not to be too controversial. But I do support the methadone program, just so you understand that, right? In the right place, okay? When I went to buy a house, I looked at my neighborhood. I wanted a convenience store. I wanted a gas station. I'm happy that we have a pharmacy. I didn't want a methadone clinic for my grandkids. And why we zone is we zone what people want their neighborhood to look like. And you just said a very important fact. We are the gateway to the north, and these people come here for their services. And I do believe that we have the methadone located in the right areas, and I don't believe it should be accessible everywhere in our city. I'm sorry, I do not. I believe I have the right to say what's put in my neighborhood. That's why I moved there. I want to live in a community with a school and with some services, not a program. And you're absolutely right. My neighbor may be on methadone. He may be. It's none of my business. Okay?
But he may be in active addiction and not able to access methadone because he doesn't have a car, because it's 50 below, because his closest neighborhood pharmacy is within walking distance, and that he could, instead of reaching the point of dark
And that's why
places,
we'll
but-
never agree. You're
Yeah.
passionate about your
Yeah.
stuff, and I give you all the credit in the world because that's what this subject needs.
Yeah, no,
okay?
I
But
do
I'm very
appreciate your
passionate on what's in my neighborhood too. And I believe I should have a say. Because unfortunately, what's happening in our communities, and just not ours, as Canadians, we're losing that the majority has rights. And when the minority starts trumping the majority, there's something wrong with our society. And I do believe in the program, but I do believe it in the right location. Because I do believe what you put in your neighborhood is what you get. And unfortunately, in our community, we have a large transient population. And so that's why I support the 6 that we have. They're in the right location. They're not noticeable. They are not. Because one, I know that I won't tell people that they don't even realize they're dispensing methadone, and I believe in privacy, so I have no issue with that. But I do believe that as a resident in my neighborhood, that I should have a say what goes on in my neighborhood, because that's why I moved there.
You have access to
And
that
so,
neighborhood due to
uh,
inherent privileges.
Can you
Oh,
tell the speaker
I'm so
she can't
sorry for
debate
interrupting.
me?
I thought you were
I'm
done.
sorry you can't debate me.
So as the chair, I'll just advise, and I should have said this earlier, but we were having a bit of exchange, that I'm going to ask if the speaker would just not add comment unless being called on by the chair.
Of course,
Thank you.
Thank you so much.
Yeah, so that's just my comment, that, you believe it should be accessible all over the city, and we'll never agree on that point, because I believe in every program, there's a perfect spot for it, and sometimes it's not in the neighborhoods. But thank you, and keep your passion going, because that's a problem that we have to solve. Now, maybe you can help me. I do have one question, and I can find it. I can find a program that says to me, today we started with 100 people on the program, and today we're really happy to celebrate we've got 20 people off the program. We're down to 80. I found that the majority stay on it, but in different doses, and continues on. And again, that's against my general principle. I believe in treatment, and I believe we have to cure people. And so I don't understand why that information is not available to the public, because we need to know that. If you say the program's working, well, you've got to have the data to back it up, that on Monday we started with 100, 20 got off the program 3 weeks later. But that information's not available, and maybe we're looking at the wrong spot. But I believe that's an important thing to know too, because I have a friend on methadone who's been on it for probably 10, 15 years. I believe he's going to be on it for the rest of his life, and he functions very well on it, okay? But he's never complained that he had to go across the city to get it. He was thankful he could get it. So that's my comments. And so the only information I wish there was more data on how many people got off the program.
So I believe that was a question for the speaker, if we
Thank
can
you very
ask.
much. So I think there's also a question as to what success in that program looks like. Elimination of therapy is not necessarily the ends of addictions recovery. I think that addictions recovery comes from the ability to no longer be actively seeking that addiction, stabilization, being able to sort of reach those points where you are no longer necessarily a burden or a harm to yourself or others, and you've been able to reintegrate into society. And I think that, sort of Alcoholics Anonymous will be the first, group that's a very established group to say that it's a lifelong journey, and whatever sort of supports in that realm are required are sometimes necessitated.
Thank you. Councillor Kilmer.
Thank you very much, and thank you very much for your presentation. I do have a couple of questions that I think help me understand better. The methadone, is methadone given, is it a liquid, and then it is prescribed by whom?
Prescribed by, at this stage, any general practitioner has the ability to do so. It is provided as either a liquid or it can be provided in a different formulation of a methadone-like substance called Suboxone, which is a tablet.
Okay. And it can be in the prescription, it can be prescribed to be, I don't know the right term, but watch you while you consume it, or you earn the right to take it home as
Correct.
as part of that?
So over time, it's usually a daily witnessed dosing until the patient is stabilized on a dose, until they have had urine screenings that have shown that they are not using other illicit substances. They're compliant with attending their appointments with physicians. They've been good patrons of the facilities that they've been using. And then at that time, carries is what they offer. And so sometimes that'll occur over a weekend, and then sometimes that'll be somebody who will get a week of carries, up to 2 weeks of carries, and usually by the time somebody's got 2 weeks of carries and a low dose is when they taper off of the program.
And that is determined by their healthcare professional that they have been seeing, not necessarily the pharmacist.
The whole team, in fact. Yeah.
The
yeah,
whole
being-
team provides that. They're
Mhm.
working as a unit, as
Yeah.
their healthcare provider. Okay,
Mhm.
thank you. I keep hearing the word program and clinic. And in my brain, when I hear program and clinic, I think of, we just went through COVID clinics with multiple people, large groups of people in line. Is that what you mean by methadone clinic, or is it methadone just like any other prescription that I go to my pharmacist, go to the desk? Correct. I'm not in a appointment line with groups of people. So is program and clinic different than
Yeah.
methadone dispensing?
I think so, and that was, I think, what I had the hardest time understanding about this issue when it first was brought to my attention, was that we were referring to these methadone dispensaries and these methadone clinics, but methadone is just a drug that is offered through pharmacies, for the most part. There are some actual, addictions and detox clinics, and those are quite institutionalized, but the non-institutionalized version of a methadone program can occur in pharmacies. Now, granted, those daily witness dosing, there's been a lot of structural and operational changes that have been done to facilitate it being maybe a little bit more confidential, a little bit more private. But certainly when I first started practicing, they just walked up to the counter just like anybody else. And the only difference is that they didn't leave with their medication. They drank it right there. You signed off, then you witnessed it. And you also, asked them all of the pertinent questions. But that is ultimately where, when we look at this as a restriction in a zoning bylaw that has a pharmacy that's established, this is superseding what would be a normal scope of practice of a pharmacy.
Thank you very much.
Yeah.
Councillor Edwards.
Thank you, Madam Chair. And Amy, thanks for coming and giving the presentation. It's much appreciated. A couple questions for you. What are some of the illicit substances that the individuals are addicted to?
Sorry, that they are.
What are they addicted to? What are some of the substances?
So it's opioid use disorder. So it would be heroin, diversion of things like codeine or hydromorphone, fentanyl, any of those that are, sort of in the realm of opiates.
Right.
Yeah.
So the hydromorphine and the codeine.
Yep. Yeah.
Often prescribed medication is how they get addicted, right?
Yeah.
That's an accurate statement?
It's just as common, if not a growing concern. So part of the, part of the change in, perception and role with healthcare providers is trying to change that.
So
of course.
overprescribed by healthcare professionals has helped lead to this crisis.
It's a huge part of it.
Yeah.
Absolutely.
Yeah, that's unfortunate. I noticed you quoted me in your report. I'm Councillor Blake Edwards, and,
Yes.
and you used a piece from PA Now. So I'm assuming you read an article but didn't really hear the discussion.
No, and I did look for these things, and in retrospect, and this is one of those things where in bringing up the evidence around crime, when criminal activity was brought up, it was sort of this opportunity to show that there was particularly that reference available. But I'm not really someone who likes to call someone out, and I do realize there was probably a greater context to that conversation.
Sure, absolutely.
Yeah.
There was greater context to it. I'm a supporter of the program.
Okay.
When used properly, methadone and Suboxone is is a really good program. People function in their day-to-day lives when they can't, when they're on when they're illegally using the substances, the heroin. You know, I understand that. I work with the program on a regular basis in my day-to-day job. So I have some understanding. But I also want to know, and maybe you can help me answer, why is it sold illegally? Why is methadone and Suboxone continually, and not maybe regularly, but still sold illegally after the use? They get it and they sell it. How come? Why do others want this product?
Usually to carry them over until they can buy their next drugs.
Right, so
Yeah.
that Suboxone can still
Now,
provide the high.
Suboxone would be very unlikely to do that because it does tend to actually more likely elicit withdrawal. There's a complex nature in the way that Suboxone is used because it is both what we call an agonist, so it turns on the opioid receptor so that it stops withdrawal, but it's also an antagonist, so it does not allow you to have the euphoria from it. So ultimately, those people that are still in active addiction usually can't start their therapy on Suboxone because they'll experience actually almost like elicited withdrawal from the drug use. Methadone may be a little less likely, but diversion is pretty unlikely. And again, most of the time what we're seeing is we're also looking at those patients that are getting a larger supply and they are doing urine screenings regardless. So if there's no methadone in your urine and you've been dispensed methadone, then you kind of get kicked out of the program. So it's certainly less likely for diversion, I think, than probably the prescribed medications or, along the lines of the Tylenol 3s and the hydromorphones and things like that.
How often is the urinalysis completed on an individual?
More frequently at the start of their program, of course, but I would say, and I can't be quoted on this mostly because it's I don't know for sure what the practitioner's guidelines are.
Yeah.
But it's frequent enough. I seem to recall because we're usually, as the pharmacist, telling them you've been notified that you need to have a urine screening, and it's non-prejudice in the way that they do that. Whether or not you've been on this program for 2 years and you get 2 weeks of therapy at a very minuscule dose, or it's your first day, you're being called down for screening and an assessment on a regular basis.
Yeah. Okay. Yeah. I'd be curious to find out how regular that urinalysis would be. I know healthcare system is severely overworked right now, and
close to 1 to 2 times a month. One every month or every other month for stabilized, and multiple times in the month is possible for those individuals that are just starting off.
I certainly raised my concern with the product over the diversion.
Yeah,
and it's a serious. It occurs. It happens probably more regularly than a lot of us know about it. Yeah. I work in the penitentiary. It certainly occurs there. Yeah. It's an abused product. A lot of residents, and you quoted about I've talked to residents, they're concerned about criminal elements. Well, when you're diverting generally, it does end up going often to people that have been incarcerated or are on parole or anything. It could be. I mean, addictions lead to incarceration. We know that, right? And you've quoted that, and I understand that. But there is a concern in residential areas. And so that's why I supported the overall zoning bylaw, for sure. It wasn't that, it attracts all criminals. I work with offenders, and that's not the way I talk. Right. So that's just not the way I am as a person. And I support the program. But I do think there is a place for it, for sure. Maybe there could be some areas that are closer, but I certainly don't think it should be in the middle of a residential area, for sure. Right. Thank you.
Thank you. At this stage, I'm going to ask if I could pass the chair to Councillor Kilmer so that I can also enter the queue, but I'll move to the next speaker here, which is Councillor, I'll operate the machine, Ogrodnik.
Thank you, Deputy Mayor. Amy, thank you for your presentation and your passion on this subject. I have a few questions and then a comment. One question was, how successful is the program? And I guess I got an answer already. Mayor Dion had asked that question. Another question, in these neighborhood pharmacies or in a small pharmacy, not the Safeways or whatever, but in the independent drugstores, how many patients or clients would a typical drugstore have that would be doing the methadone program or administering that particular medical procedure?
You know, I think it depends entirely on sort of the operational and structural abilities of that pharmacy. You know, if you know that you don't have a good space, if it's a small space, then you limit the number of individuals that you can care for because you are ultimately trying to stay within the scope of safe practice. Certainly I will say that, and I have worked in both very large and very small pharmacies, that, you know, part of my motivation for suggesting that something like a small neighborhood pharmacy could be very valuable is sometimes the type of just personnel and resources that are available in those spaces, because they're maybe only able to take on 10 to 12 methadone patients. Those 10 to 12 methadone patients are known extremely intimately. They're supported and they're, you know, compassionately understood. I'm somebody who very much supports understanding the person behind the prescription, and sometimes in these larger institutions where you have 250 methadone patients and they're just, you know, they're just kind of coming through, getting the drink, and then you're just making sure that you're signing the paperwork. You're not really having a chance to engage with them and help them along their addictions journey.
Okay, thank you. Next question. Who makes decisions on what services are provided at a drugstore? Which level of, like, is it the province that makes those decisions with the College of Pharmacists, professional pharmacists, I think you mentioned?
Yeah, so the scope of practice is designated by the Saskatchewan College of Pharmacy Professionals.
Okay.
And so part of their, some of their mandatory training now is on what we call OAT, or opioid antagonist therapy training, stigma and mental health. And so it is understood by us as a pharmacy profession that we should all be offering methadone services.
Those services, yeah. And that came through in your report to us, that you were concerned about City Council kind of intervening or making a suggestion of what a drugstore should or should not provide, is what you were saying. I heard that. The other question, we have a lot of care homes. I think we have 115 care homes or something like that in Prince Albert, somewhere in that neighborhood. And is it safe to say that in some of those care homes that the operators of those care homes are have methadone in those homes and clients in those homes? And when they when they get to that point where they're stabilized, that methadone is brought to that care home. Is that safe to say?
It is a little bit more accurate these days. With COVID-19, there was an exemption called Exemption 56, which was put in place to make things like methadone dispensing, the transfer of narcotics, just kind of simplify things in a time of total chaos. Having said that, that exemption has a deadline, and ultimately, unless there is a regulated health professional within those facilities, daily witnessed or any witnessed dispensing outside of the prescriber saying, of course, you can have 7 carries or kind of things like that, is not permissible. So right now, within the exemption, we can have something like, you know, if there's not a nurse at the impaired treatment center, the staff there can witness the dosing of methadone, so long as the prescriber indicates daily witness dosing by you know, impaired driver treatment center staff. But I think that exemption is till 2026. It was extended beyond this year. But again, there is sort of a limitation on that. And again, just some structural
That
requirements.
extension was provided by, or that...
That was a Health Canada exemption, actually.
Health Canada, okay.
Yeah, yeah.
So it's safe to say that some residents that are living in care homes are on the methadone and are that group that you said is safe to take it home on the weekend when they can't go to the drugstore to get it.
Yeah.
That's
yeah.
safe to say. Yeah. So it is in our community everywhere. I know in my ward, I think I have 17 or 18 care homes in that one ward. And Councillor Kilmer has 27 or 28. She has the most in the entire city of care homes in her ward. Councillor Edwards alluded to it about the stigma, and you had mentioned that not all people on methadone are homeless, drug violent criminals or things like that. It could be, I could be on it because I got addicted to heroin or whatever, or morphine or whatever. That's correct, right? Yeah. And so there is a kind of a little bit of a stigma attached to it, that it's all the residents in our community that are seen by some as being undesirable. I guess my comment, my big concern, I guess with our bylaw that we made, is that, are we overstepping our reach? Like, I understand that in my neighborhood there is a convenience store at the end of the street, and I don't like everything that they sell, but it's a convenience store, and so that's what happens. And so what would happen if we had a council that all of a sudden thought whatever drug shouldn't be sold in drugstores and banned it? For example, birth control pills. What if we all of a sudden had a council that was all pro-life and said we shouldn't do that? It's an example. I know, Mayor, I'm stretching it, but should we as a council say these are the medical procedures that should be in a drugstore or in any, like in a store? Like, should we be able to do that? I don't know. And I don't know legally if we would win, and I'm not a lawyer, we have a solicitor, I'm not going to ask him, but that's my concern, is that would we win a case in overriding what Health Canada has said, or the Saskatchewan Health said, that this is what happens in drugstores? Pardon? We'll see in the future is right, but that's my concern, is us stating, as I said, what medical procedures should be taking place in drugstores. And if we don't want those medical procedures, knowing these are all the possible procedures, then we don't zone that area as a drugstore. That's what I'm saying. Just like care homes, we need to know what's going to be provided there, and then if it changes significantly, then do we have a right to say that they shouldn't exist? I don't know. Our director has said maybe not. Anyways, I strayed from the topic on that one. But anyways, thank you for your presentation, and I really enjoy your passion and your knowledge. Like, holy crap, do you know a lot about this subject? And it's really good to see that people in our community are that knowledgeable and can share that with us, and hopefully get rid of some of the stigma that's attached to this particular medical procedure. And I thank you for that.
I believe I've passed the chair, but I call on Councillor Head.
Thank you, Deputy Mayor. I was missed in the queue, but I appreciate allowing me to speak now. And thank you, Amy, for your presentation. It was very insightful, and I can't agree more. Some of the comments we hear, especially from Councillor Grodnick, I do feel that this, first off, I guess I'll say that you raised a lot of good points. There's a lot of misconceptions about methadone use in our community and kind of what surrounds that misunderstanding. So your report here is quite insightful, and I do appreciate some of the responses you listed here. One that sticks out to me quite a bit. Decision makers' unfounded and prejudiced bias against this program having created barriers to harm reduction services that actually increase community risk for crime and community members' health disparity. And I can't agree more. I feel like these pharmacies, we have an abundance of them throughout our community, so we're okay with them existing there. But because it might provide a different service and bring in a different clientele, we're reluctant to have that in our community. I disagree. I think you touched on it. Accessibility is important. I did learn today that we had 6 in the community. I knew of 1 for sure. So they're not all, a detriment to the areas. People aren't even aware, and I think the mayor had even touched it, aware that these things are happening around our neighborhood. So I am okay with having some of these clinics or programs within those pharmacies if they're administered properly, safely, and well regulated, which you mentioned already. I feel that I did see an individual, again, to the accessibility part, pulling up in a cab and having to rush back, likely to get home because the meter's running outside. And I do see some challenges within for our residents. So having more accessible, would be my hopes. Looking at, you talked about, we at least mentioned here, detox. Maybe that's the work we need. We have 6 beds, and that's not enough in the city of Prince Albert. If people are wanting to make changes today, they're going to have to be put on a waiting list. So it doesn't matter if you hit rock bottom, you're not going to be able to get into there because of that waiting list. So that needs to be addressed as well. But, you touched on good comments about providing services that limit and reduce the crime and violence that we see within our neighborhoods. And this could be one way to, I know it's not going to solve the problem, but it's going to bring accessibility to individuals so they don't have to travel throughout the city, or at least have a little bit more ability to treat their addiction. Because if people ever had to deal with addictions within their life, with their family, it is awful, and it's something that, I can't stress enough that needs to be addressed, and it's something that's forever. So these programs help to address and deal with that. And if it's, I wasn't aware that our bylaw restricted, blanket restriction for all pharmacies. I know when there's some exceptions to it, it comes to city council, and I haven't seen one yet from a certain pharmacy. I think there was one on the agenda, but it had been withdrawn without explanation of why that wasn't the case. So I think if it's just a matter of us changing a bylaw to help the citizens of Prince Albert, bring some more accessibility to these programs that show that there are some benefits to it, then I think we should do that and make those changes. So thank you very much for your presentation.
Okay, so Deputy Mayor, go ahead.
Thank you. Thank you. I would like to make a motion that administration provide a report regarding zoning restrictions on methadone dispensaries. And I guess I could...
Thank you. Go ahead.
Thank you. So the zoning restrictions that were implemented over 5 years ago by this council, and I think that there are members of this council who were not on council at the time of that decision. So a report from administration may be useful to give that information, and also an update for those of us who were here at that time. I think it would be an appropriate response to what we've heard, and we've heard a lot of discussion here tonight. Thank you.
Thank you. Mayor Dion.
I will not be supporting the bylaw. We have a program now that I think it works. We have 6 clinics. You don't even know where they are. So how can you talk about we need more? You don't even know anything about the subject. At least get yourself educated. And what I find interesting about the methadone discussion, then why do we restrict pot stores? Why do we restrict selling of alcohol? Let's open up the pharmacies. I remember when pharmacies, she talks about pharmacies, they're not pharmacies today. Drugstores aren't drugstores. You go in there, they've got groceries, they've got everything now. I was finally happy that they finally stopped selling cigarettes because we have a cancer problem. We have a diabetes problem, but some of our drugstores have the biggest and best selection of sugar products around. And so don't get into the thing. What we have now works, and it's very successful. And I don't think we need it. We don't allow pot stores in our neighborhoods. Why? Because we want to live in a neighborhood where we can raise our kids and our grandchildren. And I don't think that's too much to ask. And we talk about, well, we should make it more convenient. Well, sorry, people. Make it more convenient? The majority, you got to remember, the majority wants good neighborhoods, peaceful, quiet neighborhoods to raise our kids. And the one that withdrew, he withdrew strictly because he was going to lose half his customers. That was the vote for him. I personally asked him. He said, I got so much negative response from my customers that I realized it wasn't worth my effort. And that's why, and so I can't support this. I think it's good, the one that we do have, even though it's just for a report, that let it rest, The one we have works.
Thank you very much. Sorry, I was remiss to say thank you very much, Amy, for your presentation. We've moved into the motion.
Of course, yes.
So you are able to sit down if you like. And I'm very sorry. I just noticed. So very sorry, but thank you very much for your presentation. Is there any other discussion? Councillor Edwards.
Thank you. I won't support the motion either, and it was loud and clear from the residents that I've heard from and the businesses surrounding a certain pharmacy that they didn't want that. They didn't want this. And yeah, we talk about fairness, but there's also another side. There's also voices of other people that still need to be addressed. That's important. We can't lose the light of people also remaining or having an opinion on where they want to live and what they want to have around them. They still have some choices. You're right. When you move into a neighborhood, you know what you want. There it is. Now a pharmacy pops up in a general neighborhood, and maybe there's one coming. So what do? Not support the pharmacy, and you can't run and get Tylenol because they're probably going to put methadone in the clinic or in the pharmacy? Well, that's no good. So this is why the bylaw came up. So I won't support it. The bylaw, it's a good bylaw. I've heard it from the residents, loud and clear.
Councillor Grodnick. Oh, sorry, Councillor Zerkowski. I didn't look this way. No, I did not look this way. You did the line. Sorry. Go ahead. Go ahead, Councillor Zerkowski.
I'm a little confused as to why the motion was changed in front of us. The original motion was not to receive and file. The original motion from the Agenda Setting Committee, which the Deputy Mayor sits on, was to refer it to administration for a report. And so that is a motion that I probably would have supported. I'm still thinking about it. I'm not opposed to continuing the conversation, especially that gives me time to talk to my residents and it brings the conversation out into our neighborhoods. So this motion here, I think, is very narrow in its scope and probably predetermines an outcome that I'm not comfortable with.
Councillor Grodnick.
Thank you, Councillor. Chair. Yeah, I'm not sure that this is the motion we want, Deputy Mayor. I think the original motion said that the correspondence be received and referred to the Planning and Development Services Department, maybe for a report back to us, or something to that effect. I think that would be maybe what the direction that we should go, and so I'd ask the Deputy Mayor to kindly rescind her motion or not rescind, take it off the table and just add those words to the original motion, and it's the same thing, I think. Just one thing that I want to say, though, is from what I understood, these services are provided in drugstores, and so actually a drugstore today could just start offering that service, and we would be in a legal challenge then with them of whether our bylaw supersedes Saskatchewan Health and Health Canada. And so that's going to be interesting if that happens. We have a drugstore that just does it without even saying anything. And you know what? I don't know if we all would have known, because as you said, Mr. Mayor, that we have 6 of them. I don't know which ones are all providing the service and not. And so that drugstore, had he just did it, it might not have created a lot of negative comments. But he was trying to be open and transparent with the community and ended up withdrawing it. Thank you.
Okay, before we move to Councillor Head, the mover, are you willing to change your?
Yes.
Okay.
The intention is what.
I'm sorry. I just actually moved it to the deputy mayor. So
Yes. So my intention was the wording that Councillor Ogrodnik is stating. So what I wrote down from what Councillor Ogrodnik stated, that this item be referred to the Planning Department for report to come back to City Council.
Okay. Councillor Head, sorry. Go ahead.
Thank you. And no, yeah, no, I don't mind the motion change. That's kind of was going to be my question. And I can realize that there's some discussion around this already back in 2018. I do think it's more of a discussion piece. So that's what this report would generate. But that was the question to the director. What do you plan to do with this, with the original motion, I guess, looking at, referring it back to your department?
Go ahead, Director.
Thank you, Chair and Deputy Chair. So my intention with this motion, there were some, some legal discussions throughout the presentation this evening. So certainly I would refer to our city solicitor to cover those and make sure I provide you with accurate information. Not only that, I would summarize the report that was completed in 2018 and where that originally originated from, which was a motion of council. So I'll provide that information to you as well. And I will clarify what zones currently allow for methadone dispensaries, and it would be, from there I would take direction from council if you'd like to receive it as information or provide further direction.
Thank you, Director. That's looking forward to that report.
Thank you.
Thank you. Seeing no further, go ahead, Councillor Miller. Sorry.
Thank you. I was just wondering the same thing, that if you're going to ask a lawyer for opinion, because I do believe that we shouldn't be restricting anything that's none of our actual business.
Thank you.
Well, I just
Mayor
want to
Dion,
caution
sorry.
the Director of Public Works that when he says, I don't want him to say where they are. He mentioned that, he was, it's important that we protect the privacy, because I do want the 6 to operate the way it is, and I do know that some of the neighborhoods may not like it. So I just want to caution the Director that he said he'll look at the zoning. I just want to make sure that he doesn't flag and cause somebody undue grief, because it is a hot potato subject.
Thank you. I do not see any other comments on the floor, so we'll move to, we do have a motion on the floor. We'll move to a vote. On this motion.
Go to the bottom. Nope. Okay.
The vote is now open. Vote carries. Thank you very much. I give the chair back to the Deputy Mayor.
Thank you. 5.4, Homelessness Action Initiative. And I see we have a verbal presentation from Dr. Chad Nielsen. Welcome, Dr. Chad Nielsen, and thank you, and we are happy to hear your verbal presentation.
All right. Good evening. Thank you, everyone, for having me here today. Just here to present to council the progress that has resulted in some considerable opportunity for this community to look at solutions for homelessness. As this chamber is aware, the Homelessness Action Initiative was launched just short of a year ago. And that was an opportunity for the community to come together to better understand some of the contributing factors, some of the consequences, the impacts, and obviously solutions to homelessness. The partnerships involved included this city as a corporation and the Community Advisory Board on Homelessness, which was administered by Riverbank Development Corporation, and the Living Sky Center for Social Inquiry, which is who I represent. And the initiative, if I were to put it into a basic summary, was about bringing different stakeholders together from different human service professions, the business community, government, and also the community of homeless that we have in our community. There are individuals affected by chronic risk, and I was able to spend quite a bit of time with those individuals. The result is knowledge. and opportunity for solution builders to actually be informed in that process. And so what I present to you, to council here, is a summary of that initiative that you have access to already. And some of the key themes coming out of that initiative were the fact that it is a chronic problem. It is a very complicated problem. And if we properly frame the problem under a domain of chronic risk, we will be in a much better position to solve a lot of the challenges that are impacting this community, as opposed to just relying on the blanket statement of homelessness. And so moving forward, the recommendations that I provide to council is to support the mobilization of a chronic risk solutions forum, which would involve multiple service professionals and organizations and governments to come together and start actually addressing many of the individual problems that resulted that were identified in this project. The document, the report coming out of this, puts solution builders in a position to actually get some of the work done. There's nothing more inefficient and ineffective in human service delivery and social innovation than random meetings where people come together and they passionately share their opinion and walk out with no action. There's no appetite for that in this community. I think there is harm being done if we were to waste time being inefficient. And so the recommendations I have is for the city to emerge as a backbone, not a sole owner, but simply a backbone to catalyze conversations around people that are in the right position to make solutions happen. And the immediate solutions to focus on are already being actioned. The YWCA, who is part of this initiative, has recently stood up and has worked with the province to secure a cold weather shelter facility. That's for this winter. It is time limited. It gives us a little bit of breathing room to get a sustainable solution in place in the future. The next action item that I recommend is for a chronic and acute risk facility of permanent stature that members of this council and other Indigenous governments have already started exploring. The other recommendation is for an end to the fragmentation of homelessness supports in this community. It is really unfortunate and a symptom of the great problem why we do not have the connectivity and collaboration that we require to actually get a handle on some of these challenges. The other recommendation is for a look at one of the unintended consequences of chronic risk, and that is needle discardment in the streets. These are 5 of multiple problems identified in this initiative, but it is a start. Action is already underway, and immediately there are action teams that I've mobilized and will be working with shortly to continue the work that this initiative has started. So to wrap up, I would encourage council to continue to support the city as a corporation to be a backbone for this work. And be the glue that brings a lot of the partners together. All of these partners exist in their own silo. They exist in their own funding streams, mandates, and work plans. And there is nobody that really pulls them together into a single space of collaboration. I do believe that for now the city could provide that for at least the next while to get through some of these really heavy lifting required projects. So with that, I will thank you for the time. And the artifacts of this initiative are in your possession. And I think that at the end of the day, the information that was collected is useful, and it will guide the human service professionals as they work together to find solutions. And I think that this council supporting the initiative that, like you have, brings a lot of pride to the people that are finding solutions. Thank you.
Thank you. We'll move into discussion. Councillor Zurikowski.
Thank you, Dr. Nielsen, for the work you've done and the work that you're going to do, because I think you're right. I think we, as the corporation of the city, need to be involved in setting the playing field and getting the experts into a conversation and getting them engaged. Both the funding agencies, all levels of government, the experts in those ministries, and the experts in our community that can provide those services. We've been screaming and yelling for at least 2.5 years about bringing people together to find solutions, because we can't do it ourselves. This is our community, and certainly we have a responsibility but those with the funds and the expertise are not in this room. And so part of the roadmap I'm hearing is engaging those organizations to find solutions. I'm always amazed at the competitive nature of the funding agencies and those who receive funding. And the other question I have is how can we move forward in a non-threatening environment so that they are allowed to do what they do best, and that's tackle the issue of homelessness. We've been banging on the doors of our provincial counterparts, of our First Nations friends and neighbors, of the agencies that provide services provincially. And getting them engaged to the table has been very frustrating. We can't hit them over the head and say, you will do this, because they'll do what they want to do despite us. So I think there's a certain part of public shaming involved, if I may use that phrase, for people who are not, and organizations that are not interested in finding solutions. I'd like them to self-identify, because I think it is going to be a team solution. One of the questions I have specifically for you is, I wonder if you could talk a little bit about some of the barriers in our community when it comes to homelessness. And I think some of the solutions and perspectives are helpful if we back the lens of the camera up a little bit. When we talk to other elected folks in Saskatchewan, even in Lethbridge and Medicine Hat, mayors and councillors, they're dealing with the same issues. And so I think it is a broader conversation about solutions. So that I'm going to lead into that. That's going to be my next question, is after you, if you could talk about some of the barriers that you've identified in our community, and then maybe if you could leak into the solutions conversation.
Okay, excellent. So I would say that for barriers, the biggest problem at a very high level is that we have ownership over individual siloed solutions, and we do not have shared ownership over the problem. So we have people that, their day-to-day business is, managing a corrections facility or a pharmacy or a hospital or a social service agency. You name your sector, they're in the business of providing that solution. That solution is engineered to provide a service once it's identified that that client or that person, that citizen, should be in receipt of those services. What we don't do is we don't define ownership over the problem. And so you look at some vague whole of society problems like homelessness, like elderly abuse, like violence against women. It is very hard to identify a sector or a constituency that actually owns that problem. And so what happens is we have people in pursuit of their solutions, and these solutions stay in these silos. And so in reality, to homelessness, what you get is you have 5, 6, 7 agencies in Prince Albert, all securing dollars, all in the name of stomping out homelessness. They're all doing their own thing. And then when we come down to November and there's a shelter, and holy cow, we need to get people under one roof. We try to pull people together, but at the end of the day, it's YWCA, in this case, thank God for them, they carried the mail and worked with the province to get the funding. What really should have happened is an opportunity for us to have multiple organizations come together, because I can guarantee you, and that's a big bet, but I'll wager that bet, that there are multiple organizations in this community already commanding dollars for homelessness. Have we had them all sit in the same room? No, we haven't. A solution that I believe the city of Prince Albert can barter and negotiate for comfortably without being a quote expert on homelessness is for these is to provide a forum for these organizations to work together, provide some discipline and communication and consistency that will allow us to have a chronic risk forum to actually get things done. And I think that's the biggest problem, Councillor Zurkowski, is that we have our whole system that's built around owning solutions, and they stick to their solutions, and then when people ask them what the problem is, they define the problem based on the solution in their hand, as opposed to actually defining the problem. This particular homelessness action initiative that this corporation as a city launched and obviously got support from other organizations started off by saying, let's redefine the problem in a proper context. And that is where we land on the concept and notion of chronic risk. And it's already opened up conversations in this community that I think can progress forward. So that's the barrier piece. I'll be a little bit more efficient on the solutions piece because I covered some of it. I feel that when it comes to solutions, we need to make sure that we specify and narrow down our problem. Just saying, well, we're going to solve homelessness is crazy. We have to really narrow it down to what is the type of problem that we're particularly focused on, and then start actually building solutions around that. So within within the Homelessness Action Initiative, for example, we identified things like abandonment. We identified people that had plans for getting released from prison. Those plans fell through. We have people that are being evicted for violence. We have people that make the decision to just live freely. So there's all kinds of different reasons why people are on the streets outside these walls. And so for us to actually start driving solutions, we need to better define those problems. This initiative has unveiled a lot of data and knowledge that can get people to the same conversation. And that's perhaps the biggest deliverable out of this project, is that we now have a common language, a common understanding, so all the different partners can actually work together on a single solution that has shared ownership. Not, oh, you do this and I do that and we don't do this, talk to somebody else. Right. Get people in the room. That's what the city can do.
Okay. Thank you for that. And I think, what are we calling hopefully we get to the next step, that body of knowledge? We're calling it a organization, a group of experts.
So you're talking about the forum?
Yes.
The Chronic Risk Solutions Forum?
Yeah. Do you believe that the provincial government and its ministry of experts should be involved in that conversation?
I think they should be invited there as an equal support, and certainly not at all any sort of authoritative or driving figure. And there's evidence behind those reasons, which are beyond scope of this meeting. But I do think that parts of the province should be involved in it, as opposed to sitting passively waiting for us to ask for money.
Okay, thank you. What would you say to folks who would have a belief that, not a problem, all you need to do is increase your property taxes and hire 10 more police officers, problem solved? What would you say to folks who believe hiring and the use of police is the solution?
Well, I would say that it would be a low wager for us to get to an outcome that we don't want to see in that.
Okay. All right. Thanks, John.
Thank you. Councillor Edwards.
Thank you, Deputy Mayor. Just very quickly, the forum. What are we looking at for timelines before we can get that moving? Because that's long overdue.
Yeah. So to me, that's underway. This project has identified a list of organizations, and it's going to be fluid. It's not a exclusive club by any measure. The idea behind the forum is to have an inclusive discussion around problems. From that identification of those problems, start identifying organizations that can be part of the solution building process. For the sake of this initiative, Council may remember that we identified a model, a protocol for solution building. 2 of these projects are already underway in the action teams. One of them is an ad hoc look at the experience that the YWCA went through to pop up this emergency shelter. The other one that I've proposed to PAGC to come back to the city and collaborate on is a chronic and acute risk facility, which I'm very optimistic would be underway as another action item. So as far as that goes, the short answer, one-word answer is right now. 2-word answer, perhaps.
Okay, good. I'll move the motion, and then I will make another couple of comments. The Medicine Hat. A lot of people refer to Medicine Hat as the answer of all answers, and everything that we've heard in certain conversations is they now have their issues again. So they obviously were tackling the homeless issue, but now have fallen out of that and have their own issues. Do we know why? Is that all part of this research that you've done? Because it's always referred to, but we know it's changed back now.
I can't speak with any authority on Medicine Hat.
Yeah.
I will speak generally on social solutions, and there's a couple of features that we could take lessons learned from Medicine Hat. A, the problems change. Yeah. B, you can't just pop something up and expect it to idle on its own and work fine. Right. And C, commitments are required to be reassured. The hub model in Prince Albert's a great example. The entire world, like I'm speaking, the world looks to Prince Albert, Saskatchewan for a solution to collaborative risk intervention. 140 cities in Canada copied Prince Albert's model of the hub to solve crime, to solve suicide, to solve every problem you can think of. The reality is it covers only one small aspect of acutely elevated risk. It's not a cover-all for every other problem. But when communities go and they herald that something reduces crime or something reduces suicide or something reduces gangs, and then things change, we have this reaction, oh, it didn't work. The reality is any solution we have has a tiny little sliver of impact. And as a city, we need to remember that. And I think Medicine Hat perhaps experienced that in the hard way.
Yeah, okay. Thank you very much.
Thank you, Councillor Zurkowski.
I've read the information you sent us carefully, and I've listened carefully to what you've said. And so on resolution number 3, the consideration of a housing committee, what I'm going to interpret there is that there's value in having a conversation with the experts, that there's value in having a conversation with people who know, who can suggest and share information in a non-threatening environment, and then look for common solutions. So I'm paraphrasing, and if I got that wrong, I'd like to know, but I think we're going to need some help on what you perceive as the value of establishing a housing conversation committee, if I may.
So, I would say that as far as a standalone, recommendation, I would say that certainly there's value in discussions around housing. But I would say to herald that as a single-pronged solution for homelessness might be short-sighted and specific. Because we could easily take the word housing out of there and have, discarded needle committee or public defecation committee or damage committee or pop-up tents on the sidewalk committee. Housing is a massive piece to this. I don't know, I guess the city would have to look at its intentions of starting this initiative and determine whether perhaps, quote, housing committee would be too specific and driving a particular solution. As far as like broader housing, absolutely, that's huge. Every community, big and small in this country, struggles with housing. So I wouldn't say it's not something that should be a priority. But in the context of the Homelessness Action Initiative, I would just say you're prompting a certain solution that is so big in itself that it might be separate.
Right. I heard what you said earlier about don't be afraid to change with the circumstances and be able to adapt to changes in your community. And I think that would probably be one example. We have a large number, and we cannot find that number of empty units in this community run by Saskatchewan Housing Corporation that are sitting empty for months at a time. And why is that? So I think that, as well as the housing agencies in the community that are able to access funding, are able to be more nimble because they know where the people are and they know the services that are required. What can we do? And I think that to help them out, I think there's no harm in having those conversations.
No, I would say it absolutely not, right? But to put that as sort of the cornerstone of the housing, or sort of the Homelessness Action Initiative, I'm just saying would just sort of pigeonhole a certain aspect of it. But if I could say out of this, one thing, a learned experience out of this project is going to be, look, the experience that we had here, defining the problem as a community, building solutions as a community, okay, can be a teachable moment for other things like gangs or crime or drugs or violence. So I would encourage the way we frame this and the way that the solutions protocol is built, that this city could stand up as a corporation to support other huge problems, but just, let us learn how we can do this on homelessness first.
I appreciate that. My fear, and spend a large number of years talking to these agencies, provincial government, the people change, the agencies not so much, but everybody, as you alluded to earlier, is in their silos and they believe they know the answer. They can do the job. They believe what's best. Yeah. And they're going to move forward with that without looking to their left or right to see what else is going on in the community. So I think we have to find a way to set the table, have those voices find joint solutions. So thanks for the work you do.
Thank you.
Thank you. Councillor Head.
Thank you, Deputy Mayor. And I guess my comment to that is, can we get to the table? I mean, this motion came forward a year ago, and here we are. still talking about trying to get to a table, getting the right people together. I think we had one meeting last year that didn't go very well, but I'm looking forward to doing some of the much-needed work that your report has highlighted, and the much-needed work by all the organizations within Prince Albert to collaboratively work together and fight some of the homeless problems we're seeing within the community. So looking forward to getting this work done and starting immediately. Thanks, Dr. Chad Nelson.
Thank you to the presenter. Any further discussion before we vote? I'll open the vote. Vote is open. Carried. And vote is accepted. Thank you for presenting. We are now moving into the consent agenda. Any items that are wished to be pulled for the consent agenda? 6.1. Pardon me? 6. Thank you. 6.2. Any other items? Hearing none. If we could have, thank you. Councillor Cody, do you wish to speak at this stage? Oh, I just meant on this. No need to vote to speak on this vote. Okay, then we are opening the vote. Vote is open. Vote is carried. 6.1. And I believe, we'll go with Councillor Cody.
Did you say 6.1 as well? Yeah. Oh, well, go ahead.
Councillor Cody.
All right. Yeah, I just want to bring your attention, folks, to the letter which we just received from Roger Peranto from the Saskatchewan Housing Authority. And you will note that the 5% which we owe now happens to be $104,360. That doesn't surprise me one iota. It's $44,598 from 2020, and the balance is 2021. What really is going to be a sad point here is if you look through your budget binder, if you have, and I'm sure you have, if you look at what the Director of Planning put in there, he says, well, we're looking at about 1,000 units that we're looking at through this year, and it's going to cost us about $40,000 or $24,000 or $40,000 or 41 cents a day, which is a good deal. Well, that's a far cry from what we're seeing here from them today. So I just want to bring people's attention that when we go to the budget, we got to look pretty hard at what this crew is doing down there to us and the reason is simple here, why this is happening. Half the units are empty. Half the units are empty. Some are boarded up. There are lots boarded up. And yet we're paying our 5% on those units which are haven't even got people in them. It's just wrong, totally wrong. We've also got security at 2 or 3 of the places now, which we never had before. And I don't know why we need to have that, but I guess you have to have it for safety's sake, for those poor residents. And some of the seniors' places, which they call seniors' homes, they now are allowing almost anybody in as a renter just to fill them up, which is wrong as well. I don't know if we have a member anymore, or I know we didn't used to have, but I thought we had a member of the council on this board, but I don't know if we still have or not, or if we ever filled it. Not sure about that. But I just wanted to bring your attention to the fact that when we get to the budget, let's look carefully at this program that we've got going here.
Thank you. Councillor Zurikowski.
So, thank you, Madam Chair. Question to administration, if I may. The motion to refer to Financial Services Department, what is that? What's the effect of that motion?
If we could hear from City Manager.
The motion would be to pay the bill.
Okay. All right. So then I have some questions. I'd like to know how many empty units we have in our community. I would like to know if we can have representation on the body that makes these decisions, because these are tax-paying dollars and housing is an issue. And I think there's a lack of information. I'm not comfortable simply signing the check, and I won't sign the check. Somebody else in the room will. But I think there needs to be a little bit more accountability here. And we've had this conversation before, and I'm not afraid to have it again. I think we need to scream and yell and continue screaming and yelling until we have representation with this taxation, and that's what it is. And so the motion in front of us, I think, is inadequate. If we're going to refer to financial services, I think it needs to come perhaps 6 weeks after correspondence comes from this body, asking about some details about those units in our community. Why are they empty? Why are they not in use? And when's the next meeting so we can attend as a voting delegate?
Thank you. Mayor Dion.
Now, I can update you because I appoint. They just gave us permission to appoint, and my colleague to my right, Charlie Miller, has accepted, so she will be our appointee and to the Housing Authority. And I agree with Councillor Zurkowski. The other question we should be asking is how many houses have they sold in the last 2 years? Because we are to get a percentage of the house sales. So I think that's the important thing too, because I've heard they have got rid of a few. And if you remember, for some of my colleagues that were here, they sold quite a few that 1 year and they wanted to keep the money, and we made them pay us the 200 grand, which was our share because we never did get a profit out of this agreement. So I do think that's another question that we should ask them, is where do they stand? Because they were still selling off some of these homes to make those other two buildings. So I agree that we should be asking more financial questions on where do we stand with housing sales and what's our percentage that we're getting back on those. And then I like the vacancies one as well, because this is a housing one that's subsidized, okay? And I think the other question that we should put on that list too is when is the government going to really put the SID program back in where the landlord's name is on the check? Because that is not happening. Even though they said they're back to that, that's not a fact. I've talked to 10 landlords. It's not a fact. And they said they were going to reverse it and put it back. And that was part of our homeless strategy too, because that caused homelessness when they were getting the checks directly. So I do think there's just more. I agree with my colleague, and maybe he heard my comment, he can draft something.
Thank you. Councillor, I'll go to Councillor Cody and then back to Councillor Zurkowski, if that's all right.
Yeah, just a question that I forgot to ask is, why was the 2020 bill for $44,598 not paid? Whatever happened there? Why was it not paid? Is there
We're going.
supposed to be some reason why it wasn't paid?
Go ahead, thank you.
Thank you for the question, Councillor Cody. Since I was notified I had to come to the meeting tonight, I did look into that matter. So in discussions with Mel and Jason and the city clerk's office, we did find that the last documentation submitted was in early 2020 for the 2019 losses. That was $14,986.72. They had not provided any further documentation regarding the 2020 losses up until now. So now that this letter includes both 2020 and 2021 losses at that significant amount. So they were provided with letters from the city clerk's office dating back to June of 2022. And as you had indicated, the 2022 budget is only for the $14,990 because that was based on what was for 2019.
Okay, so they just didn't bill us. And that's what the problem is there, which is fine, we can, but I think the question that Councillor Zurkowski is asking for finance to get us before we pay the balance of the 104 at least, I think are necessary before we proceed.
Councillor Zurkowski.
Thank you for that. Well, especially since what occurred last year, we need to ensure it doesn't happen again. I'm uncomfortable with that process, and perhaps by asking questions and being at the table, that'll help. I wonder if, I see my learned colleague across the floor is taking dubious notes. I wonder, do we know how often they meet or when the next meeting would be? Do we have that information yet? No. Okay. All right. Well, thank you to Councillor Miller for attending those meetings and looking forward to the reply.
We need a motion, Mayor Dion.
He referred it not to. That the correspondence referred financial services to ask and bring back the answer to the following questions. Number one, in 20, because they just billed us for 20, right? 20 and 21. That my questions is, number one, in the year 2020 and 21, was there any house sales? And if there was, how many? And what is our share of the sales?
Can we just pause while we get that done? Were there any house sales?
Yes.
And what was the city's share of the house
Yes.
sale, correct?
Correct. Can we get a vacancy report? That's what we're looking for. Can we get a vacancy report? And number three, do they have an active plan on how they're going to address the vacancies? And if there's any hurdles to filling those units? Yes, in brackets SID, yeah. Perfect. I think that covers it.
SIS, right? It's the capital S, capital SIS program.
Okay, can we jump back to number 2, City Clerk? Can we get a vacancy report? And are any of those vacancies boarded up? And if they are, can we get a status report on their plans for the future on these units?
I think instead of statistics, it was supposed to be status on the status.
Status, sorry.
Yeah.
Yeah, status.
Yeah. Okay.
Perfect.
All right. Any further discussion on the motion? Seeing none, I'll move to the vote. Vote is open. Waiting on one vote. Carries. Vote closed. 6.2. Believe was Councillor Head.
Thank you, Deputy Mayor. I just have a few check numbers I'd like to pull. So I'll go, there's a few numbers I have. I know we're going into budget deliberations, so this could be helpful as well. So check number 89, 114, 126,
If we can just pause, 114,
126, 136, 140, two others, 197 and 207. Thank you.
Thank you. Any further discussion? We'll open the vote. Vote is open. Carried. Vote is closed. We will now turn to what is listed as 7.8, request for 2021 tax relief. 67 13th Street East, with a verbal presentation. Thank you. Go ahead, thank you.
Thank you, Deputy Mayor and council members. I'm here today to talk about the Cumberland Crossing Tax Relief Report. So the property located at 67 13th Street East had previously been acquired by the city through the tax enforcement process in 2020. Upon receiving the property, the city was then required to maintain it and incur the cost to keep up with this maintenance. So the property was then tendered, and Cumberland Crossing provided the highest bid without any conditions and was awarded the property. Since acquiring the building, numerous upgrades have been made. They have replaced old damaged ceilings, upgraded the heating system, and are currently renovating the building to include a daycare facility, which has included adding in plumbing and cutting in 10 new windows. Their intention of the property has always been to benefit the community. The property is intended to provide both housing and a daycare facility to students, as well as housing for those who may have sick or dying loved ones in the hospital care. Transforming an abandoned hotel into a facility that is intended to provide a positive benefit to those in need is a great addition to the city. The request in front of you today is to relieve the 2021 property taxes incurred on this property. Cumberland House Cree Nation became aware of the outstanding taxes this past summer and has indicated that their intention when they purchased the property was to request tax relief for the first year while they performed the required repairs and the building to get to a point where it was operational. Since becoming aware of the outstanding property taxes, Cumberland Housing, we have a representative here today, has worked to pay off the outstanding debts. This included arranging meetings with administration to discuss a reasonable payment plan and pay off the 2022 property taxes. These property taxes and related interest amounted to over $227,000, which is entirely paid off. Due to numerous upgrades and the property required to become operational, the benefit that the property is intended to have, and the commitment to pay off the 2022 amounts in a timely manner, administration is recommending to approve their request for relief of the 2021 taxes and related interest.
Thank you very much. And I appreciate the presentation and that the representative from Cumberland Crossing is here. We'll move to Councillor Head.
Thank you, Deputy Mayor. I'm going to go ahead and move the recommendation from administration.
Any further discussion? Councillor Zerkowski.
Thank you. There was some discussion about the services that they provide. So I have to ask, as it was almost alluded to, is this a nonprofit activity or is this a for-profit business in our community?
Is that something that Vanessa Vaughn is aware of, if it's for-profit or nonprofit?
I'm not too sure exactly how to answer that question. I don't know if you...
Okay,
I'm going to ask Councillor Zerkowski, are you asking if we can ask that question of the
I think
representative?
that if we don't know the answer, I don't know why we're forgiving taxes to a business, because there are a number of businesses that would be interested in the same conversation.
I'm going to ask the city manager, are we aware if this is a nonprofit or for-profit business?
I would say they're probably considered somewhat both. They are a for-profit. They are trying to ensure that they can pay for the services that they're going to provide in the community, such as helping those residents come down to visit their families.
Yeah.
I think the key for this tax relief was that the city did own this property. It was taken over by tax enforcement in a very decrepit state. When it was being, when we did tender it out and or look for interest in purchasing the property, Cumberland House did come through with a fair price to pay for the property. The one thing is that it was in very bad shape. They had to do a lot of repairs to even move it forward. At the time, my understanding is they did speak to asking for tax relief for the first year until they could fix the majority of the work. I'm not sure exactly what happened with that request. I'm not sure if it got lost in the mix and it didn't come forward for council's consideration at that time. But it did come aware to us when we did approach them regarding the payment of taxes. They were very receptive to ensuring that it was paid up, and they did make those arrangements. So this is a peculiar situation. Because we had it in tax enforcement, the city had it, and it was in very bad shape. So
thank you for that. So the amount of tax that have been paid, I'm looking for that number. If somebody can say it, they can. So $225,000 in taxation has been paid, and that's from what year?
that's the current,
the
the
current year.
2022.
So I'm looking at the report from August of 2020, and it doesn't, there is no request for tax exemption. I guess, to be fair, that report just deals with the sale of the tax title land of that land. And I heard the city manager's comments on that one, so. Okay, thank you.
Thank you, Mayor Dion.
Yeah, and I'm going to support it strictly because I actually toured the building while it was up for sale, and we struggled to keep the heat on. And I know they paid a fortune to put those new heating units in. And I think it got lost in the mix with our change in our head of our corporation, because I know it was talked about when they did make the purchase. And they paid us back well over $800,000 at that time, and that was in their arrears for the taxes. And they are current now with their current taxes today and the water and everything. So I believe that it's deserved, because they did do us a big favor by taking that property off our hands, and they have invested quite a bit of money to bring it up to stuff.
Any further discussion? Hearing none, I'll open the vote. Vote is open. Carried. Thank you. We will now move on to Airport Terminal, 33% preliminary design presentation with Prairie Architects. Thank you. I'm just going to arm the podium. Sorry, go ahead. Thank you.
Okay, apologies. I'd just like to begin by thanking Madam Chair and the council group for having extended the length of the presentation. As you said, my name is Damien Finet. I'm from Prairie Architects. I'm the prime consultant for the airport terminal. The presentation I've prepared here should walk you through the process that got us to this 33% preliminary drawing set. It's broken up into 3 sections. So I'd just like to review the existing airport terminal, review some of the facilities that we toured as a precedent, and then walk you through the design. So the Prince Albert Air Terminal that is currently in operation was built in 1983. It's roughly 5,300 square feet. It has a hold room, a seating area of 82 seats, and in 2019 had 35,000 passengers running through it. What you see here is the front entrance of that facility. And this is the airside facility. I'll try to keep it brief. I'll try to keep it within the 20 minutes, so there are sections I'll go fairly quickly through. So what we were currently tasked to achieve is to do a long-term forecast projection basically a planning horizon of 2040 on the facility, which anticipated a 45,000 passenger load in 2040. It addressed 115 peak passengers, so increasing from the current 55 to 115, and then anticipate a secure flight running through the facility. So one of the analysis that we did do was the facility users. So it's fairly unique in the terminals that we did tour. It has three specific types of users. One is the scheduled users, so that's northern residents that are traveling to and from the north. What we found was those residents travel with large baggages. So coming in from the northern communities, they would have a minimum of 2 bags, and then traveling back up north, they would have multiple carts and large goods. This also, you can see in the image on the left-hand side, this is a photo taken of an existing daily occurrence at the terminal. Charters are different. They're fairly efficient. And then the third is the professional. So basically business people, educational, legal professionals. So very distinct types of travelers through the terminal. The image at the bottom in red sort of denotes the square footage of what a scheduled passenger would occupy in that space. So I've overlaid that block in the existing floor plan of the current terminal, just to give you a sense of space they occupy. So the zone in gray are administrative spaces. They're the back of house, the cargo area, the washrooms. So in the current facility, you have 4 check-in counters, but only 2 are able to be used, just because of the amount of area that the passengers do occupy. The facility is stepped up, so there is a ramp and stairs. So there is a ramp, but there is some accessibility challenges. The passenger drop-off pickup lane is congested, so it's a little too short. There isn't a rental kiosk for rental vehicles. The cargo space is inefficient, so that's another unique component to this facility. There's a lot of cargo that's being flown up north. That cargo can be items like doors, tires, it could be oversized televisions. So the cargo component is very unique to this facility and very undersized in what is currently offered. So what you're seeing here is the passenger flow. So this is a departing journey, so somebody that would be using the facility to travel up north. So the blue line, I don't know if you can see my cursor. You cannot. So the double-ended arrow off of at the bottom of the plan is the entrance of the facility. So there is one point of entrance into the airport. You would travel to the 2 check-in desks. As you can see, the 6 blocks is roughly the area occupied by 6 passengers with full load. And then they would travel back to the 82 hold seats on the left-hand side. And then eventually, once the flight arrives, they would travel up through the vestibule on the top side of the plan. Now, as a passenger journey arriving from the north, you would use that same vestibule. You would travel directly to the exterior, either to start your vehicle or bringing it to the passenger pickup zone, and then come back into the facility for the luggage pickup. Because the travelers are traveling with an extreme amount of baggage, there is a buildup that takes place at the baggage belt. And then what you see when you cross those 2 arrival and departure zones, you have a number of conflict areas. So basically at the air side as well as the arrival side, and multiple points using the washroom, so on and so forth. So generally, this is some photos of the current facility. So the top right-hand image is a view of the cargo room. As you can see, the capacity is well beyond what is reasonable. The facility basically has no ability to address secure flights, so there is no screening area. There's no ability to accommodate a larger flight. There is no administration space. There's basically no ability to expand this facility. So, having identified and reviewed the existing terminal, we, along with the city of Prince Albert, toured 4 similar size airports within the Prairie region. So we looked at Lloydminster, Lethbridge, Medicine Hat, and Brandon. These are all like sizes facilities. The first one we toured was in Lloydminster. It's a terminal that was built in 1981. It's basically remained as is with minor configuration changes to it. It's roughly 11,000 square feet and has 101 passenger seating area. And it sees about 25,000 passengers traveling in 2019. So this is a floor plan of what that facility looks like. Again, the gray area is the administration spaces or back of house services. The white area is the passenger flow. So what you see is on the top of the plan, they have 2 points of entrance for the journey, so for arriving passengers and for departing passengers. They also have 2 zones for hold room. So I have a secure hold room and a non-secure. And then they have a CATSA screening station. So out of all the facilities we toured, they all had a CATSA screening station. They all had a secure zone. They're in the process of expanding their facility as well. Basically, the baggage drop-off area was undersized. It's very similar to what Prince Albert has. So it's a very short-run, one-directional baggage belt. So they're experiencing the same buildup with luggage. So this is a view of what they have. There are limited kiosks. So on the left-hand side, you can see that the kiosks that they do have in place, which is part of the renovation, are underused. They have basically an express coffee station. However, they do have a more generous check-in area with 4 different checking stations. The CATSA screening is on the top right. The hold room is on the bottom left. And then you can see some of the vending and concession areas. What they have integrated into their facility is a NAV Canada flight service center. So the tower and the observation cab is part of the existing facility. So Lethbridge was the second terminal that we saw. This was the largest terminal. It's about 29,000 square feet. It has a hold room that has 80 seats. I'll talk about that in a minute. And it has about 104,000 passengers traveling through it. So it was built in 1979 with a minor renovation that took place in 2022, which reconfigured the hold room, the area basically in blue on the top left. And as a matter of fact, they underestimated the hold room requirements, and they've already anticipated another expansion. Essentially, they don't have the seating capacity that's required. Some of the lessons we learned here was that the departure and arrival takes place on the air side, which is at the top of the page, through the same space. So as passengers are loading out to the plane, passengers are coming in and there's congestion taking place there. They did have a very generous arrival hall for the baggage pickup. So that was meet and greet space. That was an appropriate size for this facility. They had 2 entrants off of the land side, so basically off the drop-off, which helped with the flow. So passengers departing would flow through one vestibule to the check-in area, and then the opposite on the left-hand side. There was a car kiosk and then vending machines, essentially. So this is a view of what that looks like. So NAV Canada is located on the 2nd floor of this terminal. It's the only terminal that really had 2 floors to it. The bottom right-hand image is what their hold room looked like. So it looks more like a hotel lounge. So it's quite nice, but it accommodates only 80 passengers and was, again, being slated for renovation only a year after being completed. The third was Medicine Hat. Medicine Hat was built in 1942, but went through a very extensive renovation in 2014. I would say it's almost a new facility to a certain extent. It's about 18,000 square feet, had 58 passenger secure seating area, and saw 75,000 passengers flow through it. Here what we saw was 2 dedicated passenger journey departure and arrival zones, one on the drop-off side and one on the air side. So passenger flow was very efficient. It had a recirculating baggage belt, which is on the right-hand side. So baggage buildup did not occur. It could just circulate on the belt itself while passengers were either out at their car to start the vehicle and come back in. From a departure journey, it had a very generous ticketing area with 6 ticketing booths, as well as a CATSA screening station and a hold room. And within their hold room, they had a washroom, which was not present in Lloydminster's. What was unique in this terminal was that they had a commercial kitchen. It's something that I believe the community had lobbied for. I do have an image of what that looks like. So it's the top center image. So it's a pretty high-end commercial kitchen. It was in operation, I think, for the first year, maybe a little bit more, but I think since that time, it hasn't seen any use. They can't find somebody to operate it. So the idea was that a hot service would have been a benefit for the terminal, but the passenger flow time just wasn't significant enough, and people weren't making the airport a destination to go use the restaurant. It also has a NAV Canada tower on the end. It has some kiosks on the bottom left-hand for car rental, and then the bottom two images are the view of the CATSA screening area and then the hold room. So it was a nice facility with the renovation. The last terminal that we saw was built in 2017. This is a terminal that Prairie Architects did. It's probably the newest one. It's 17,000 square feet. Has a hold room of 108 people. This is an all-secure hold room, which essentially means passengers have to flow through CATSA, get screened, and then you can use that hold room. There's no non-screened people allowed in that space. It sees about 50,000 passengers in 2019. So this is the terminal as it stands today. It has two dedicated arrival and departure. So the left-hand side is the departure vestibule. The right-hand side is the arrival vestibule. And then the double arrow on the bottom right is the arrival departure off of land side, essentially. So passengers would come in, go to the check-in area, and then it has a very large meet and greet area with a recirculating baggage belt and a view out to the apron. Leading to the left is the CATSA screening, and then the secure zone. So this is what that terminal looks like. So it's an efficient terminal. It has open washrooms, easy flow in and out. It has some concession areas, but in the form of vending machines throughout. And then it has a car rental area at on the air side. So all of that said, we were then able to formulate a concept design that we have a consultant engaged on our team that's Airbiz Aeronautical Consultants, and they specifically helped review some of the planning approach, the sizing of the facility, the space sizing. So it's maybe a convoluted slide, but that's what this is demonstrating, that they're reviewing the departure journey and the arrival journey and right sizing the facility based on that need. And we've also approached a number of stakeholders and gained their approval and support for what I'm about to present. So CATSA was engaged to review the screening station that we're proposing in this facility. NAV Canada was also engaged and approached to review what we proposed. Rise Air was consulted for the passenger flow, the cargo requirements. So now we're leading into the design of the facility. So the building on the top right is the existing terminal. So what we had to develop was an airport terminal that would allow the existing terminal to remain operational during construction, obviously. So we evaluated the site and established that the space to the left of the existing terminal offered the opportunity to reuse the existing apron, so minimize costs there. It allowed us to utilize the existing parking and expand on it, as well as the drop-off zone. So existing parking stall is currently 96. We've expanded it to 46 in the proposed approach. So the final plan, which I'll walk you through it, ended up being 21,000 square feet on the main floor. You'll see it in the next slide, but there's a component to it that has space on the second floor. The second floor has the mechanical room as well as NAV Canada's administration space. And on the third floor is the observation cab. So as a passenger flow, a departing passenger would enter into the orange zone. So at the bottom of the page. Again, I've used that same block scenario to illustrate the 30 square feet, or the 5x6 requirement for a northern traveler. So you can see based on the queuing area that we could accommodate 32 passengers waiting for the queuing and the ticketing area up above. And then passenger flow would run left to the building, so it's a very linear east-west oriented building. The next step would be, if it is a secure airline, you would travel into the pink zone. And the pink zone is the CATSA screening station, so you would queue within that CATSA screening station and then run through the body x-ray and the luggage x-ray. If it's secure, your luggage could then travel directly into the baggage room. If it wasn't secure, you would have checked in your baggage in the orange zone at the ticketing counter, and that would lead into the baggage room. What we've done is we've got a hold room with 115 seats based on the load requirements. That hold room can be separated into 2 zones. So right now, the light pink on the left-hand side is delineated by some dotted lines showing a self-contained hold room. So it would be in a closed position, and you would then have 2 separate hold rooms, if you like. And if it's a non-secure flight, it could operate as a full hold room of 115 seats. So this is some of the diagrams that we've reviewed with CATSA for the screening station. So again, they've provided us with their approval in principle with what we've shown here. So the round red circles are passenger queuing zones. And then the blue circles are CATSA operators. And then there's the X-ray screening station and baggage belt leading into the baggage room. The orange zone is the hold room, as we just discussed. Now, the yellow area denotes the passenger arrival journey. So you'd be coming from the north side of the facility through one vestibule entrance, so separate from the departure zone. So the departure from the hold room would have 2 separate gates, but leading out 1 separate door. Going through the yellow zone, you would then be presented with a recirculating baggage belt, an oversized baggage chute, similar to what you see when there's skis and just larger goods slide down onto the stainless steel chute, and then a door accessing it. And then central to the facility is 1 washroom bay. So rather than having a separate one for the arrivals and the departure zone, it's been centralized in the middle of the building. It's what we call a lobster trap concept, where there are no doors, and passengers can flow in and out, without having to navigate doors, so it's very efficient. The green zone shows vending machines, as well as a car rental kiosk on the left-hand side, directly off of the arrival zone. And then finally, on the main floor plan is the baggage flow. So again, unique to Prince Albert, there's such a large amount of goods that are traveling up north that you need to have a baggage room that has connection to the ground side, so essentially non-secure. So that allows people with a truck to back up and drop off that door or the tires or whatnot, and it's presented with an overhead door that leads directly into that baggage room. We're showing here in the red lines some of the vehicle flow. So the right-hand side is the oversized baggage. So I don't know if you can tell, but there's a line leading from the passenger queuing area, from the check-in, directly circumventing the passenger queuing where the ticketing takes place to lead to that oversized baggage. So you can deal with it within the terminal as well. But it's a dedicated area that has its own door leading into the baggage room. On the left-hand side is the arriving baggage. So the most efficient way, and one that we saw in, I think, 3 of the 4 terminals that we did tour, was a baggage drop-off that took place directly from the exterior. So it's under a sheltered canopy with a windbreak wall, but it's on the exterior, and opens up to the baggage belt, allowing the baggage to be dropped off and accessing the oversized baggage as well. Yeah. So NAV Canada was also integrated into this plan on that second floor. So the diagram that you see here is what's being proposed on the second floor for NAV Canada. So the image on the left is the existing flight service center. And the view right below that image, the rectangular view, is the line of sight obstructions that they're currently experiencing. So there's 5 pinkish blocks, I don't know if you can see them, that are the points where the planes are obstructed as they're leading down the runway. So what we did is we simulated using a 3D model their existing views and what would be achieved if they were integrated into the new terminal on the second floor. Correction, actually, the second floor is the administration. Their flight observation would be on the third. So a far improvement from what they're currently experiencing, and that was certainly well received. And this is a view of that second floor, so the mechanical space on the right-hand side. The zone that's in orange and yellow, that's the linear atrium that is a higher volume space that interconnects the check-in area with the departure zone. That's what that's showing. And then the purple is NAV Canada's administration space, so training room, equipment room, offices, and basically all their requirements. And then this would be a view of the terminal. Basically, you're almost in front of the existing terminal as you're driving up to the airport. So the right-hand side, you see a vehicle that's backed up to the loading zone. The orange area is a single-story, somewhat compressed area for the check-in and the departure. And then the white portion behind is the atrium connection across, but also the mechanical room and the NAV Canada office space behind. Similar view, but night view. This is now on the opposite, looking back. The existing terminal has mysteriously disappeared. And you get a sense of the portico, the shelter of the baggage area on the left-hand side, and the volume of the building. Now this is on the apron side, looking back directly into that baggage area. You see the arrivals door. The double door is just to the right of that. That's the oversized baggage drop-off. And then the glass area on the left is the departure gate vestibule. And then you have the NAV Canada administration space in the glass 2-story portion, and then their observation cab up above. This is a view of the check-in area as you're coming in through the vestibule with the carrier offices and the airport director's office, manager's office rather, at the back side of the building, and then on the left-hand side is the check-in kiosks. This is a view looking back towards that entrance. Now this is basically a view looking at the oversized check-in area, looking down the atrium, the higher volume, towards the hold room. Essentially, if you're going to go down that corridor, once you've done your check-in process, you would turn right to enter into the CATSA screening or continue straight down to the hold room and the seats. On the left-hand side would be the washroom facilities. So this is one side of the hold room. This is a view of it in a closed condition. If there was a secure flight, you would close those partitions, and within that room, you would have access to the gate, as well as a washroom and vending machines. It would probably live its life mostly open, so then you would have access, similar to this slide here, to have a full access to the 115-seat hold room. This is a view where you can see the baggage belt as people are arriving on the left-hand side. You can see a little bit of a chute, a black box to the left of that blue wall, and how that atrium sort of ends, and the clear story wraps down and behind the baggage belt. This is a view as you're arriving from the arrival vestibule, baggage belt on the right-hand side and leading out to the vestibule. How's my time doing? Am I going quite a bit over? Okay, so this is basically the end slide. There's some finishes that we're reviewing. Again, this is preliminary stage, so we're just exploring what the finishes can be. We're looking at durable, maintenance-free, inexpensive. There is some tile work, but that's from a maintenance point of view. Everywhere else would be sheet vinyl flooring to keep things efficient. Some tile work to protect some of the walls. This is color concepts. And then the schedule. So essentially we began this journey back in June, and we're here today in November with our 33% set, looking for, I guess, council approval to proceed with the project. Thank you.
Thank you for the presentation. We'll go to discussion. Mayor Dion.
So I have a couple of comments and questions. So in talking to CATS, the security company, so they're going to change. Are you aware that we did have secure check-in? And I phoned today, whether we had secure check-in or not, we would still have to go through security again in Saskatoon and Regina. So that's why we removed Casca from the airport, and they agreed because they had staff here. And so has it changed? So if I go through security now here and I fly to Saskatoon, I am still going to be required to go through security? Do you guys know something that we don't, that they're going to allow us to go through security? They never have, and they still continue not to. And the other thing is maybe WestJet has changed their mind. They've told me no 3 times. Air Canada won't even talk to me about flight. So please explain to me why we need security and spend all that money. It's very expensive, especially when you mention a body scan. God, they won't take my bag. So I don't. So that's my first question is does someone have a document that says if we put all this equipment in, they're going to allow us through without going through security check? Otherwise, we don't need it. Right. Because flying north, they don't need it. Then the other question, I don't know if you answer this, I'll refer to the director. When you toured these airports and went on this tour, were there any committee members that went on the tour? Like, I don't know who all went on the tour, so I'm asking that question because it will go to the airport committee first and then come back to us. So I just wanted to know if there was any committee members on the tour. If you can answer that, we'll get the director to answer that. But I need to, my biggest question that comes up, I like the plans and everything, it's just that you haven't convinced me that we need the security. That's going to be the most expensive part, building that unit and getting the body scanner and everything back in. And I'm amazed CAT Scan didn't say to you, well, what's changed? We had the equipment, we took it out. And so I don't understand where we're going. So if someone can answer those 2 questions, why do we need a secure area? Are they going to now start accepting us as secured? And who all went on the tour?
I'm going to turn to the director first. Thank you.
Thank you. Thank you for those questions. So on the CATSA, when we had CATSA years and years ago, if you went through their screening process and got on the flight that used to be Transwest and to Saskatoon, if it pulled up to the main terminal, you could enter directly into that terminal. I rode that flight. I know that you went from secure to secure. What changed was the situation where those flights were no longer going to the main terminal. They were going to Transwest. And of course, we had security during that time after 9/11. We didn't have security shortly thereafter, about 2012. This is when they took it away. So from that point forward, any flight that was leaving Prince Albert went to Saskatoon, didn't go to the main terminal. It went to the provider's airport. Or if it did go to the main terminal, you'd have to go through security again. But we didn't have security for the last 10 years. So that's the issue. But when we did have full security back in the 1990s, you could go from terminal to terminal and you went straight in. The other question was on the tour. The tour was done back in June, I believe, and it was just members of the administration that went on that tour with the architectural team. It was to discover what possibilities that we could look at and then bring this forward to council and the committee for discussion purposes.
Thank you. Mayor Dion.
So just to follow up, so all those people that went on the tour, are they in the room today, or is it just you in the room?
I went on the tour. The manager of capital projects went on the tour, and the manager of engineering services went on the tour.
Okay, I'm still stuck on security. So what have changed? And just so you know, at the time, 15 years ago, I flew every week. I went PA, Saskatoon, Regina, Calgary, came back Calgary, Regina, Saskatoon. Half the time we didn't stop in Saskatoon because we had no mail to pick up, so they flew me right to Calgary. I was the majority of the person on the plane. And we had security then, and I went to security, and every time we landed, I had to go through security again. So you must have got lucky because, and they unloaded us on the tarmac just right outside the terminal. We never once went to the Trans West, but it wasn't back then.
Yeah.
They've sold so many times. So security is very expensive. Where I'd sooner see the security, where I believe we need it, and where our customers and our northern reps are asking us, is to put that security system in the baggage department and check the freight so we can stop the illegal bootlegging that's going on in the north and the drugs that we're flying in out of our airport. So they'd sooner see those x-ray machines in the freight room and not in the passenger. So I still not, I got to be convinced on why all of a sudden we're going to get a security, and unless you can supply me a letter that says we're going to be whisked right through, I don't know why we need it.
I guess on the secure room, just a point that CATSA, we provide the space and the facility, the space for them, but they provide the equipment and the security. So if we were to have a secure flight someday in the future, one of the airlines, that would be provided by CATSA, but we're providing the space. Our thought process was that in the interim, that space could be used for just what you said, Mayor, is on occasion, the local tribal council along with the northern communities have set up temporary security at the airport, and they screen passengers' baggage and their luggage, right? This space could be used for that purpose until the day that CATSA was to arrive. We're trying to make sure that we don't pigeonhole ourselves, because if someday in the future we got a WestJet flight or an Air Canada flight or some other airline flight, that we would have this space. All the other places that we visited have a daily flight with WestJet. So that was our aim.
Thank you. Any further discussion? Councillor Zurikowski.
So just, I want to clarify what I heard, because administration of the day was very adamant. Take security out, you don't need it, you don't need it. So what I've heard is this design includes space for that if we choose at some point in the future there's a need for security, then we can move in that direction. There's space available there. So the question about whether at this point you go through security in Saskatoon or not is mute, because what I'm hearing is, and it would have been helpful if members of the Airport Advisory Committee went, that's one of the reasons why we formed that committee, that at some point in the future, if there is a need for that, we can put that into that space. So that conversation about going through Saskatoon security again twice is mute, because that's not what we're saying. That's not what we're hearing from the department. Is that right?
Well, our architectural team, we did provide, as you saw that one slide, we did make contact and sent our drawings to CATSA, to NAV Canada, Transport Canada, and Rise Air. We did have consultation discussions with all four. CATSA returned that they like everything that they saw, everything that they need for a future secure flight is there. The space is there, and the layout and the flow of the passengers is there. So, but we also considered what we've been told by Rise Air is that with the local tribal council, they've had security set up on occasion to try to stop the illegal items going north. That space could be used for that purpose until CATSA was to arrive in the future.
Can we take a look at the picture of the cargo drop-off area? Take a look at that. I have a question, if I may.
The floor plan?
The exterior, it's an exterior view from the...
This one here?
From the south side. Yeah, right there. Okay. So I see that, and you alluded to it as well, that there's a lot of cargo that goes through the airport. And I'm trying to see the 3 pickup trucks or the 4 pickup trucks trying to get into that area, take up the driving lanes and back up to the gates.
That's a very good...
Rather than a sort of come and go without taking that space up, because it's probably not going to be one. There's going to be a few at a time. So is that a consideration? And maybe I'm not aware of the operations as much as some others in the room, but I need help on that one.
I can speak to the taking up the lanes. One thing I did neglect to mention was that we do have a 3-lane system here. So that allows queuing of cars in 3 multiple lanes in front of this building. So there is a lot of bypass that's able to happen. As far as the unloading of goods, it probably...
You've been down 2nd Avenue, yes, with the 3 lanes? Yeah.
I have, yeah.
Okay. Sorry to interrupt.
And then on the loading area, what's shown here in the plan probably would accommodate 2 pickup trucks, potentially 3 in a row. Anything bigger than that then would probably encroach onto that drive aisle.
Great. And so operationally wise, help me out with that cargo area.
Okay.
I drive up with my 6 doors and my several tires, and I drop them off, and then I go park, and then I enter through.
That's exactly correct.
And where does the screening of my cargo take place? Does that take place?
Well, the operation of that is probably by the carriers. Once it is within that baggage room, then a screening process could take place.
Okay.
But there isn't any scanning of that equipment
That's
as it's leading the truck into the baggage room.
That's right. Okay. Good. We won't tell anybody that, though. It doesn't happen. I saw from the north view, the stairs were on the exterior of the building.
Yep.
Is that because of cost
So-
mostly than having them inside the building?
That one there, I have to admit, is it's a stair that's basically there for code egress from the mechanical room. What can take place once additional consultation takes place with NAV Canada is that if we're able, I think you're talking about the central stair right here, right? On this image?
There's an exterior view of the artist trend.
Oh, okay, well, airside.
Yeah.
That is the one that's on the plan that was shown there.
One of those views, yeah.
So we can actually abandon that exterior stair, but it becomes another conversation that we need to have with NAV Canada on how exiting can flow through their space. So if their space is secured on either side of that corridor and it becomes a public service corridor only, with nobody else other than service personnel, we can lose that stair.
Okay.
But in the time being, we've incorporated as a worst case scenario.
So that's why we're at 33%. We have that flexibility of 33%. Okay.
Correct.
I couldn't find the elevator in the rendition.
There is a lift. It's located on the right-hand side behind that baggage drop-off.
Okay.
So that's where the dedicated stair for NAV Canada is. So you can't see it really in this image, but it's behind the vehicle at the extreme right-hand corner.
Okay.
That would be NAV Canada's point of entrance, as well as a lift within that space.
Just to add, those upper areas are not public spaces. That's only mechanical and NAV Canada secured area only.
Correct.
Okay, thank you.
Mayor Dion.
Can we go back to that picture where it showed the old and the new building?
Like a floor plan?
Yeah.
Oh, the site plan.
Site plan.
Site plan.
Yep.
It showed the,
This one here.
oh, right there.
Yeah.
Okay, so I'm glad we have this because we are negotiating for a new gas supplier. Because isn't the gas tanks now that we have to the director, aren't they close to the word new? Are they not sitting there on the ground?
They are in that footprint next to the existing terminal. They are on a skid. Talking with the airport manager, they can be easily moved if necessary. So this would be the best location for long-term of the airport. Fuel tanks shouldn't be next to the terminal in any situation. So if we were to proceed forward, we would move the fuel tanks to a better location, probably to the other direction because there'd be more space over there.
Okay, now, I'm gonna put my cost-saving hat on. I wanna see the picture of the front of the building. There, I'll say keep. Well, no, stop, okay? I noticed that NavCan and the mechanical room upstairs has that whole row of windows. Like, if that's all that's on the second floor is NAV Canada and the mechanical, why would we have a block, and I mean a block of windows that are very expensive, conductors of cold, and then I see on one other picture, there's even more glass on the other side, and I don't understand it. Right there, go back one picture. See the glass, look at coming down that side? So I don't understand all the glass on the second level when you just said that it's for Nav Canada and the mechanical room.
So those windows do not go into Nav Canada or the mechanical room. Those windows are, as you see in that hallway, this is the hallway between arrival and departure. It's a clear story. So you see the light color on the wall, that's the sun shining into the terminal. We've designed it so that in the daytime, you wouldn't even have to turn on the lights.
Okay, so they don't go to the second floor?
They do not go to the second floor. That's the second, it's like an atrium that goes the length of the hallway. And so you can see some lights hanging down. And in that wooded area, you see on the left-hand side, it looks really bright. That's the sun shining
That's
on the
windows.
wall.
Okay.
Any further discussion? I did have a question for the director. Are we intending to look at any green initiatives, environmental design, LEED standards, anything like that?
Absolutely. The direction given to the architects to build in all possible energy efficiencies that we can without actually spending the money to try to get LEED certification, because that actually costs money to get that stamp, but it doesn't mean you can't achieve those items without actually formally submitting it. So we're trying to do everything we can, just like we did with the aquatics. There are some things that, like with the aquatics, it just financially doesn't make sense. We're not at a point yet where you can, we've designed the building so you could add solar panels on the roof. There's flat spaces for them, but they're not included because still we can't find where we would actually recover our natural gas costs in a 20 or 25 year window, which is the life of the panels. So we're not there yet, but everything we can think of in doing energy efficiency, we are.
Thank you. Any further discussion? We need a motion. Mayor Dion, your light is on. Are you interested in a motion? Nope. Anyone interested in a motion? Councillor Cody.
I'll move the motion.
Thank you. Any further discussion? Hearing none. Open the vote. Vote is open. We're waiting on 2 votes. Has everyone voted? Still waiting on 1 vote. Should I close? Okay. Okay, I'll close the vote. Carried. On to item listed as 7.2, Snow and Ice Control Policy Review, verbal presentation from Jeff De Silva. Thank you.
Excuse me. Good evening, Deputy Mayor and Council. Thanks once again for the opportunity to present on our updated snow and ice control policy. So from our last meeting, we were able to review City Council's comments and suggestions that you gave us, and that gave us an opportunity to go back over the operation and gain a little more clarity on some of the items we'll go over today. So the first item I'll touch on is the snow storage area definition. We certainly understand from the last meeting that there's some real concern about using up to 1/3 of the sidewalk as a snow storage area, as this does take away from some room from pedestrian traffic. Raising this concern gave us the opportunity to review this again with operations and confirm the importance of having this sidewalk space available for storage. So as indicated in your report, there are many areas across the city where having this room is critical for effective snow clearing operations. So while administration does hear and acknowledge that there are concerns and that as those were voiced, we are proposing to leave the wording on snow storage as presented last time. Of course, understanding better now that any changes that we would make to that definition would actually potentially represent a significant change in our city's snow clearing operation. Also, at the previous meeting, City Council expressed concerns about the wording for the snow maintenance in school zones. So you'll note that we changed the wording under with respect to windrows, hoping that updated wording to avoid the creation of windrows as opposed to minimizing will satisfy the concern that windrows are not a desirable outcome in school zones for safety reasons. And finally, we'll come to parking bans, ticketing, and towing. So administration heard at the last meeting that there was some concern about how to explain when the city tickets, when we tow, and how we get this information out. We met internally to discuss this best means of explaining this to city residents and have come to the conclusion that the best message overall is that any parking within a snow, within a snow route during a declared ban or during signed temporary no parking zones will ultimately always risk having a vehicle towed. But to get more specific, to support winter maintenance activities, there are times that we do require or that we would want to have those vehicles moved. This specifically happens during snow route parking bans and snow lifts, where really the most effective option is to have those vehicles removed to complete the work. To support general grading in areas like residential, ticketing is more of a preferred option. Just the coordination between bylaw, parking staff, signage staff, as well as roadways crew to cover large areas of the city. This is something that's more supportable and coordinated. We're better able to coordinate across our operation. So with that, take some questions.
Thank you. Mayor Dion.
Yeah, I have a couple of questions. Of course, I don't support the third. So have you looked at the changes that we're going to have to make to our sidewalk cleaning bylaw? Because it says I have to clean my sidewalk. Well, no, I don't. You're going to dump a third of it with a windrow. So that means I have no more responsibility of cleaning my sidewalk. So that's just a question. Have we looked at the sidewalk bylaw? Because the sidewalk bylaw gives me 48 or 24 hours to clean my sidewalk.
So
well,
we have the Clean Sidewalks bylaw. That applies only to the downtown core. So that's effectively delineating when sidewalks in the downtown core are cleaned.
So we don't have a sidewalk bylaw, so I don't have to clean my sidewalk in front of my house?
Within our policy, we do have that residents are asked to clear the sidewalks, and that once that 1/3 of the sidewalk is occupied with snow, that does not become that is obviously not the residents' responsibility to keep clean.
Okay. Question now, snow storage that we're dumping. I see we still have the snow dump by the hospital. Okay. How do they get in there?
Off of 10th.
Yeah, over the sidewalk, over the rotary trail, and down the road. That's not acceptable. Over the curb, over the boulevard, over the rotary trail, and down the road. The year before, we used to not have those barricades in that lit intersection, and we had them come in there, drive down the road, we plowed it, drive down the road and onto the road and in. So how are we going to rectify that? I was shocked when I seen it. Like, what are you doing coming down the road, going over the curb, over the boulevard, over the rotary trail, and down this trail to the snow dump? We're a professional city, so that's not acceptable. To me, I wanted to give them a ticket for driving over the rotary trail with a 3-ton truck. So how is the department going to rectify that? They used to, the year before, we didn't have those cement barriers up at that intersection on 28th and 10th. And they went there, they turned left, and we plowed a trail through the dirt. We plowed a trail to the road, and they went on it. And I think we have to go back there. I don't think the rest of the council are looking at me and saying, is that how we get there? And that's how we get there. And so I'm going to change this motion, or if you guys are going to correct it, we have to get a better way. You can't have those trucks going over the curb, over the boulevard, over the rotary trail. It just, I've never expected to see a dump truck on the rotary trail. I was caught off guard to the point I had to turn around because I thought, boy, maybe I got to put my glasses back on. So I need to know from the department how they're going to rectify that, because I don't know, it's not acceptable to me, and maybe I'll ask the rest of council if it's acceptable to them.
Councillor Head.
Thank you, Deputy Mayor. A couple comments. I've now that we're in a snowfall this week, I've gotten several calls from residents to kind of express some concerns that I think is a viable to this conversation today. Also, to the mayor's point, I think I thought there was an access to that snow dump on 15th Avenue West, so I don't know if there's if that's still open for the snow dump in that area. And then I had a couple of questions that I think it's important that we look at as well. I see in our bylaw that priority 2 listing bus stops and school zones, speaking to a 48 hours notice, and I flagged that because our buses got canceled for 3 days. And residents were missing work, school. I've heard from parents saying I can't park or drop my child off in front of the school because we have mountains of snow. And I know that you didn't create the snow, but I'm saying how do we do a better job of removing it? Because I feel like the residents are saying that we need to do better. And so looking at this timely policy coming forward, I think it's important that we try to get it better. And if that means additional grader or additional manpower to do that, staffing, then we should probably be looking at expanding our snow lifts, our services when it comes to snow removal. Because I find I get called probably the most on some of these issues on how we can't drive around our roads. I know that the crews are out there busy, but we rely on the staff or the contractors to provide that snow removal for us, and I think we need to maybe look at it internally, what we can do more of it, not waiting that first day, second day, waiting for those jobs to get done before our school zones and our bus zones get addressed. So that needs to be looked at, or even maybe just to reflect the actual timeline, because 48 hours does seem quite restrictive for the department to get to those zones. And then some of the comments about snow lifts. I know we've addressed some of the snow lifts in the bylaw definitions, but it doesn't actually speak to, and maybe I missed it, I'm sorry if I did, but it doesn't speak to when we're actually doing those snow lifts. I know in my ward, on 13th Street specifically, a lot of the snow is pushed to the south side of the, north side of the road, and our residents are having to climb over these massive snow banks to get to their cars, which doors can't even open unless you're parked halfway out on the road. And so we need to maybe look at maybe lifting some areas on a more frequent basis when we get these massive amounts of snow. So just a couple comments for your department. Thank you.
Could I call on the Director Hicks at this point on those issues? No? Okay. Are you, I guess the question is Councillor Head asking questions of the department or no? You are? Okay, go ahead.
Okay. Thank you. I'll try to respond to all the questions there, including the mayor's.
Thank you.
The crossing that goes to the snow dump on the south side of the city. So we cross the rotary trail at 90 degrees. It doesn't drive on the trail. We don't follow the trail. We cross it. It's the similar situation, which is on 16th Street West. If you cross the tracks and you go south on the gravel road, we cross the trail at a 90 degree. It's a gravel road. Right. So actually, well, it is. It is a right of way. It is a roadway. It was a road that we used to get out at the intersection where the traffic lights are and just travel down a dirt road. But now that we've built everything, they travel down an actual road and then cross there. The curb has been cut, so there is a actual crossing there. It's not, they don't drive over the curb. There is actually a cut, and the asphalt on the rotary trail has not sustained any damage on 16th Street West, which has been in place for several years now, and they get traveled on by loaded tandem axles and concrete trucks from the operator who's down that roadway. If we have any issues with this crossing, we'll certainly deal with it. But it is the shortest way to get into the site and is the shortest way to cross the rotary trail. And it also takes the trucks out of that intersection. Before the lights were there, there was a few issues with traffic because they weren't expecting that truck to come out from that dirt road. So, I mean, right now, we feel it's the best solution, and so far, we haven't encountered any issues. We do have other, like I said, on 16th, we have some other locations where you can drive across the Rotary Trail in that fashion. To your point, Councillor, about the timing, 48 hours is quite a challenge, even at that, to get priority ones completed. Most of the bus routes traverse across most priority ones. The fact that the buses were not able to run on that Monday morning is certainly a problem, but I guess we have to understand that during such a large snow event, even the cities of Saskatoon, Regina have days where their transit has to stop because of winter blizzards. In this case, well, since the 1st of November, we've had 41 centimeters of snow. There's winters that was in the entire winter of snow. So it's same thing happened on the election day. Buses were not able to run on that day, and it was election day. We did everything we could to get those routes open, but they still could not be running the entire day. So I wish we could do more, but it would mean doubling of our forces. And even at that, I couldn't promise that you could get them all done in 48 hours, but we would certainly try.
Thank you. Councillor Zurkowski.
Thank you, Madam Chair. I have a couple questions, if I may. Jeff, welcome. I like some of the changes, and thank you for that. I think it's going to make our school zone safer, and you've changed the language in the policy to reflect more of the practice, I think, which is great. But I do have some questions so I understand. I'm looking on page 3 of 6 of the report. I need some help on, you have them listed here. Snow route parking bans towing, temporary parking ban for snow lifting towing, and temporary parking bans for residential grading. I think the snow route, once it's declared, that's sort of self-explanatory. I think the public gets that one. But the temporary parking ban for snow lifting, towing, and the temporary parking bans for residential grading, ticketing, how will this be reflected so that the residents know? Is that going to be in the signs that we put out? How do people know? Because they don't know.
I think that sort of what I was trying to say was effectively to make specific, unique points depending on where you're operating. That's like that'd be really detailed, and that actually requires that we go to the site and we see what's going on. If we've got a spot where you have, say, you've had a lot of parked vehicles as we've done grading operations, and we're still running into parked vehicles, even if we're signing and we've been ticketing, then we would probably be electing to tow, because at some point we need to get access to move that snow. So that's where I was saying that the fallback is that if there's a snow route parking ban, or if you see temporary no parking signs for snow operations, the assumption should be that we would or could tow you.
Okay, so then that helps Milton, because it says will make use of towing.
Yeah.
And what I've heard is may make use of towing rather than will.
Yeah.
Because I think that manages expectations and reflected in the 48 hours. I'm not interested in making it 72. Let's get them there as soon as they can. But on that one there, if I may, the city will make use of towing. So we will get phone calls if this policy passes with that wording that says will. Why aren't they out there towing? They might tow my neighbor. He should be towed. But what I've heard is may be towed, and that flexibility is needed and appreciated by the department.
Yeah, it is a challenge. So in certain circumstances, depending on where we are for timing, so on weekends, getting accessibility to tow trucks, depending on the type of event, we could be limited by our ability to just access the resources.
For sure,
to
and
do
I
it.
totally get that. So that makes sense hearing you say that. But it says you're going to do it. You will do it. And practically speaking, that's not possible. The will part isn't possible. But what you're asking for is the flexibility that you may do it when you feel it needs to be done.
Yes.
And so that's because we're going to get phone calls on this because it says will. And the public's looking at this report and they're going to say, why isn't the city towing my neighbor? Why aren't they towing 28th? Why aren't they towing 15th Street?
Okay.
Because the city says they will.
Yeah. Yeah, I could take another look back and just see at the exact wording and how we want to put that. It's challenging in a policy document to capture all of it.
May is a better word. That allows you the flexibility that I'm hearing you saying that's really important.
Yeah.
The change in the language for the school zones rather than the unloading zones, thank you for that. I think that reflects a practice that has been going on, I think, and reflected in the policy. That's great. Here we go. On page 314 of the document, policy 7.04, it says school zones will have winter maintenance completed to improve accessibility to traffic while avoiding the creation of windrows. That's what you mentioned that earlier. To avoid blocking off zones. School zones will then either have snow blown off the roadway surface or will have snow lifted to a snow dump periodically, which will be completed over the winter breaks as needed.
Yep.
So it says it will be completed over the winter breaks as needed. It seems to me that that's not the language that's reflected in practice. Right now, over the last few days, we have a great crew out there. They're doing a fantastic job clearing the school zones right now. It's not winter break. And I wish I had a donut, honey cruller for every time somebody told me over the last 4 days, that young gal in the loader, she's the best ever. Boy, you should get her all over the city. The crews are doing a fantastic job. But here, it says as needed. So I'm unsure of the intent there. Will be completed over winter breaks as needed.
That's our normal practice. So our normal practice would be in a let's call it a standard winter if we were going to get one of those again, would be that we manage this through the season, and when we come to a school break, that's our opportunity to spend a lot of time, because it does take a lot of time to get in there. You'll notice we do have it identified under 708 as well, that we will do those lifts outside of drop off and pick up times for schools. So the reality is, in a perfect world, we would want to get there on the breaks, because that gives operations the most time to just focus on completing it. Right now, what we're doing is, we're not in a normal, we're not coming off of a normal snow event, a 6 inches or something like that. So obviously, we're going to respond. We're not going to leave that be.
You're not going to wait till the winter break if it's needed ahead of time.
Yeah, but to capture that in every policy statement that, we'll do this unless, it's a big event, then we'd have to define a big event. Like, I think it would be a very difficult thing to capture in a policy document.
I'm okay with that one. I think there's enough flexibility in the language on that one, so thank you. On 710, parking bans on priority 1 roads will be declared at either 9 a.m. or 4 p.m. When a snow road parking ban is declared, vehicles must be removed from a designated road immediately. The ban will be in effect for 48 hours, but redeclared at the discretion if needed. Is that practical? Is that our practice, and is that achievable?
To declare them at 9 a.m. or 4 p.m.?
Great.
Yeah.
Okay.
I mean, we set times and we set them to be within the workday. That gives us the ability to call on for resources that we need.
Have we done that so far?
We did end up declaring one on Tuesday of last week.
The Tuesday,
Yeah.
and it started snowing on the Saturday. And because I think that, if I recall the conversation, the department determined it wasn't needed, didn't need to be declared, it was on the weekend.
But then it snowed
the
again.
work was being done.
Maybe I could add to that, Councillor. I think there was a little bit of miscommunication between Public Works and Communications Department, because I wanted to declare one on the Monday, and the notice did go out, but it didn't use the word ban. So then we put out a second one on the Tuesday.
Okay.
And that's a result of just that it's very rare that we actually make the declaration to ban. And so the last one was so long ago, a lot of the parties weren't involved. So yes, that you can put that partly on me because I don't think I made it clear enough to them, and they didn't use the wording that I was hoping for on Monday morning, so we put it out on Tuesday morning.
I appreciate that, and I think it's all about next time, right? We're all figuring this out. So my next question is, how will we do that? How is that done? How is that declared?
Well, that would end up getting coordinated, so it'd be either, director or designate.
So think of it from the public's point of view.
Yeah.
City Hall is City Hall. They don't care who. How will the public receive that
Right.
plan?
So I guess what I was saying was from the start, it would, internally, we would be convening to say, okay, can we coordinate to get bylaw available? Can we coordinate that we would have knowledge where bylaw should attend to first? And then can we coordinate to have trucks available to tow, to actually actively move in and do what we need for operations? Once we coordinate all of that, that would get brought to communications, and that gets pushed out.
Okay. How will the public hear about the ban?
If I may, Councillor, so with communications, we put it out in every fashion that we can. It goes out as a media release. It goes out on the web page. It goes out on social media. And with that media release, it gets picked up by the radio stations and the other news media, paper and online.
Okay. Thank you for that. The policy says to local media, will be posted on the City of PA website. It doesn't say anything about social media. And I wonder if it's time now to take that risk and say we can commit to getting it on social media, because people don't go to the website when they're trying to get the kids on the bus or if they're looking for, I think we're there on the social media part, and that piece is absent from the website or from the policy. And I wonder if that's, practically speaking, A, is it achievable? Because you don't want to overpromise and underdeliver. But if we can push that out to social media, the policy reflects the website, it reflects the media release. Hopefully the media gets it on the radio. We can't control that. But social media, is that something we can achieve?
Absolutely. As a matter of fact,
Yes.
the social media was the first one that went out because it's the easiest.
Okay. Can that be reflected in the policy?
It can be. We'll just wordsmith some words there to make sure that it's very general, because who knows what the next platform of social media will be.
Right, and that's why I say social media rather than Facebook, which all the old timers are on, so I guess me. Okay,
Councillor Zurkowski, I do have our Director of Corporate Services that can reply to that as well.
So, yeah, I can just confirm that social media is an easy add-on if you want to name it in the policy for the staff to add. The other thing I want to note for those that are listening, if you live on a snow route, you can sign up for the email list and get your name on that list so it comes directly to your inbox. So
Very
that's a
helpful.
good.
People like that.
That's an added communication method.
Thank you.
okay, so we're gonna add that to the policy, then social media, I've heard that. Snow containment. Can you define that for me on policy 7.13? What does that mean, snow containment?
Holding it on your property.
Sorry?
Just keeping it within a property.
Okay, so then does that deal with the whole conversation about my neighbor snow blowing into my backyard and onto my property? Or is that just the piece about businesses and individuals on vacant lots?
It's just basically defining the responsibility that if you do contain snow within your property, you're responsible to any impacts that may occur if they go onto neighboring properties.
Okay, so it doesn't then deal with the neighbor issue? That's a civil matter?
Yeah.
Okay, good. Okay. And on the, pardon this detailed question, so but I have my last one. Thanks for the patience. I'm looking at the map, and on 4th Avenue and someone's gonna have to help me out here, 25th Street, there's a little tagline of the blue line that extends on the other side of 4th Avenue. And the only reason I mention that is because I got 3 texts in the last couple hours. The signs are out. I think you guys are going there next to St. Anne's, Arthur Peachy, elementary schools. The signs are out, but they aren't on the east side of 4th Avenue, that's still within the school zone.
Okay.
So I wanted to mention that because I know that from time to time, it's been done and hasn't been done.
Yeah.
And I just wonder if you can provide some comfort to the people that, yes, if it's in the school zone, that will be done.
We specifically mentioned that piece, so we'll follow, like today when we were going over it.
Awesome.
So if those signs were missed, then that's good to know, and we'll follow that up.
Okay, perfect. Thank you so much.
Councillor Edwards.
Thank you, Madam Chair. I feel rushed. Here's a very important topic, and we have 80 other items to go through. Not sure where this agenda came from, but we're rushed on some super crucial topics here. But I will ask my questions because here we are. So, do we allow residents to clear roadways?
Yeah, we don't have, so you with me in like removing windrows? et
No,
cetera?
I mean that if they're on a certain block, can they bring in their own piece of machinery and clear their road? Could they pay a private contractor to clear their whole block?
Yeah, technically, yes. We don't have anything on rules or bylaws. Any damage, of course, or anything that might have happened from that operation would ultimately be their responsibility, though.
Yeah. So the recommendations are put your snow over here. We have that somewhere available to these contractors.
They're free to use the snow dump.
They're free to use the snow dump. But they can drive down the middle of the road and clear that block.
Yeah, not aware of.
Good
Wes,
to
do you
know.
have any policy, any bylaw?
There's nothing for us to say not to do it, but we don't endorse them because, as Jeff said, the liability completely rests with them.
Yeah.
If they hit a parked car, damage some sidewalk, anything, that responsibility will fall on them.
But I have, well, many of us probably have lots of calls that say, hey, listen, I'm paying X amount of dollars. I want the service. Well, we can't service all of those places, right? We can't just go there because you're paying a higher tax rate. And so, but they can afford, some of these people can afford to hire their own service, and now I can direct them to hire their own service rather than increasing everybody's taxes to get the service that some want. So that's great. Downtown snow lift. How much revenue do we lose by waiting, do we lose on parking meters by waiting to lift that snow out of there?
If I may, very, very little. Downtown doesn't bring in a lot of revenue anymore, even in the summertime. You'll notice most of the parking meters are vacant. So in this case, there was no way that you would be able to park in any of those meters during those first 2 days until we got the snow lift done. But it's not a large dollar value.
Yeah, we want people downtown shopping.
Absolutely, we do.
And that's, not possible during that. So I'm hoping one day we look at contracting that out as a snow lift and doing it fairly quickly.
Actually, the contractors are part of the snow lift.
Okay.
So.
They're just not available.
During the snow lift, yes, there was several contractors along with us.
Yeah.
Their
That was
trucks.
about 5 days later, right?
No, that was on Wednesday.
Yeah. Okay, good to know. And have we ever, and this is just a suggestion I heard a couple of times, do we ever think of clearing one side of the road on odd days or even days, and so people could park on the other side and we don't have this issue? Pardon?
That discussion has been tabled many occasions, and the problem exists with the NIMBY not in my backyard issue. So it will be, it's a fight where
Why would that be? What, odd
because
days, one road?
if you pick one side of the street, those people will be upset that the snow is all on their side of the street.
Oh,
Yeah, it is a problem. So we don't do it. I don't know any city who does it.
I don't either.
I mean, on
wanted to
occasion,
raise that
occasion, when we're stuck, like if you saw on Wednesday when we did the snow lift here downtown, we windrow to the middle. Of course, we're picking it up, but some of the windrows would be sitting there for a period of time. into the next day, and people were managing to drive, but of course, that only allowed you to drive, not to park. And you can cross anywhere in the block. You could only cross at the intersections.
Okay, thank you.
Councillor Kilmer.
Thank you very much, and yeah, sorry about the time, but I do want to discuss just a little revisit about the parking ban and the time and the language. It was my experience during that 3-day misinterpretation, use of language. I found myself using language, snow event, copying what I hear you guys, say, snow event. Recognize that when I read the policy, parking ban on priority 1, and it's very clear that it's parking ban. And the last time that I spoke in council, I did ask, and my point at that time was, we're not consistently using it enough so that people that are in a priority 1 understand and do. They want to do the right thing. So I think it is language used is very important for all of us, consistent language, and we now know parking ban. In the process, or in our procedure, policy and procedure, you're talking about 9 to 4. Residents spoke to me that it would be so much better if it was called at 8 a.m. because they're on their way to work and they will park, and many do park on the priority 1. So a 9 a.m. isn't a good time for them. Earlier, like, they want to do the right thing. They want to get out of the way. They don't want people to be zigzagging around. So that's just my 2 cents, or residents' 2 cents. Then the other thing is the process that happens. When we call a parking ban, I think that because we haven't done it for so long, so this isn't you, this is all of us. The people that are involved when a parking ban happens in this administration need to get together right now and can say, the word parking ban happens, and these things all will happen. You don't need to worry about the tow or the, if we have a process and we're consistent in the thing, then it allows communications who do a great job to just already have the work already out, and it will save us a ton of time. Because we did have a mix-up on that Monday. I thought it was a parking ban. I told people when I left this meeting it was a parking ban, and I got a lot of phone calls that night, and we're all on the same page. So I appreciate the work that you're doing, but I would really like you to consider changing the time to an 8 a.m. or a 7 a.m. and a 3. And I realize it has implications with people who are working here, but if we have the process already thought about, it should just be able to fall into place. That's my 2 cents.
Okay. Councillor Ogrodnik.
Thank you, Deputy Mayor. I was under the understanding that Pickering Crescent, which is off Muzzy and joins 15th Avenue East, was also a city bus route. I think it might. That's my understanding, and I know that the transportation manager is not here, but I'd like you to check that, and if so, then that should be colored blue as well, so that Pickering Crescent gets cleaned as a city bus route. I think that I'm almost certain, but check that please, because that might be an error there. We're not. I used to like winter before I became a city councillor. I don't like winter anymore because of, it's nonstop. Just people are upset with snow removal, and I know we do a good job at it as best as we can. How much does the levy that we have raise for snow removal? I can't remember what the total amount is. Do we know offhand?
That is changing. If you recall, there was a report by Finance earlier in the year, and it pointed out that the way that we were presenting it and the way that we were collecting it wasn't sufficient to cover all the snow removal, so that is changing. It was only at the time, we were only setting aside about 50% of what was required. So that
Okay.
number has changed. I don't have that with me.
Okay.
But I did look up the transit thing to answer your other question. Pickering used to be on the bus route. The bus route now goes down Muzzy and then goes down 15th. It doesn't go down Pickering anymore.
It doesn't go down Pickering anymore?
No.
Okay, so then the map is correct. Thank you for that quick response to that. Oh, that's pretty darn good. Anyways, the money, that's besides the point, but I was under the understanding, and I think people, residents, and it's what Councillor Edwards said, that some people say that I pay all this tax dollars and I don't get snow removal. The snow removal budget is that levy that we all pay. Is that correct?
That is
Majority?
correct, and it also, because it's a general revenue issue, it's part of your tax dollars.
Yeah.
I guess when a person says that, but you can't convince them of it, but it's not, their tax dollars aren't set aside for in front of their home. It's the road that they drove to school, or the road they drove to work, or the road they drove to the grocery store. It was 2nd Avenue, it was 15.
Yeah.
We plowed that street with their tax dollars so they could get there.
Okay,
So,
thank you.
but-
And I think majority of people agree with the priority one, like that's essential to have those roads open as soon as possible after a big snow event. The other things that we hear is evenings, like why aren't they working at night and et cetera, et cetera. And do you have a quick response of why we don't have a crew at night or cleaning at night?
Yes, that was discussed in Jeff's earlier reports earlier in this spring, is that the thing is, if you took our crew and made them work the evenings, they have to have a time of rest, so then you don't have a day crew.
Yeah.
So you actually haven't achieved anything greater than having them work in the day. Now, one person will say, well, there's less cars on the road. Yes, there's less moving cars on the road, but there's more parked cars in the residential areas and on the side streets, so that we have more objects to go around in the darkness. And then we don't have the support from the other departments. We don't have the fleet services. If something breaks down, then you just take it to MSC and you leave it there because there's no maintenance staff. You also don't have the sign shop, so you can't move the signs around because they're working days, unless you want to put them on nights too. And then you also don't have the tow trucks and the bylaw people because they're not working the nights. You'd have to turn everything into night shift.
It's a major change.
Yes, so if you had a night shift in addition to the day shift, then you have to have 2 crews. And you could share the equipment, but again, then the equipment never has any downtime. So you have to schedule in their services, and then we'd have to have at least 2 mechanics working the night shift in addition to that. So Jeff has put together what he thought was a very high-level cost estimate, but you'd be looking at about another $1.35 million worth of expenditures to do a night shift and as well as the day shift.
Okay, thank you. I'm not in favor of like of a night. I'm just asking the question. And last but not least, earlier today, a councillor said that we didn't have buses running for 3 days. That's not city buses. The city buses was, from my understanding, was just that Monday morning. And
City
then-
buses was just that Monday morning. They went back on the road later in the afternoon as
Yeah.
soon as the priority ones were clear.
Yeah.
They couldn't get to every stop, so there were some that they had to bypass.
Yeah.
So some stops were missed, but they were doing as much of the route as they could.
Okay, thank you.
Councillor Head.
Thank you, Deputy Mayor. I won't take too long. Thanks for the the comment about the night shift, because I did too get asked that about why don't we just run our operation at night. It is a major change and an overhaul of how we do it. An extra grader, I know, is a huge cost item as well. But more back to our windrows and when we do a snow lift, because I know in some of my areas in Midtown, there was a removal of snow on 13th, but it doesn't describe it here in the policy. And so what is the criteria we use when we are lifting snow in certain areas?
So in those areas, those really just become operational. So we don't have specific policy to capture snow lift on specific blocks or in specific areas. We do a lot of it in the spring for spring runoff, so in known problem areas. But again, those are assessed because it really depends on how the snow is accumulated through the winter. So on 13th, as a great example, is like last year, I recall those snowbanks, and they were tall, there were sightline issues. We did go in and lift those.
Yes.
So on items like that, I would put them through as requests for service. But then, yeah, they don't really hit that policy level because we can't specify certain blocks or areas by policy.
Well, I appreciate it. I'll be putting a request for service then for that area then. But yeah, thank you for that.
Yeah.
Mayor Dion.
Move the recommendation.
Any further discussion? Councillor Zurikowski.
Based on the conversation today, I'd like to add a couple of things to the changes to the policy, if I may, to the mover. One, that 7.11 be, social media be added to that phrase, which I think also includes the media release on the website, and I'm asking to have social media included on 7.11. And based on the comments from administration, the second point be that when we talk about snow or towing, that the language be changed to may instead of will. And I'm tempted to engage on that whole conversation about dumping snow onto the sidewalks, but I think I'll leave that for now.
And is that agreeable to the mover? It is. Any further discussion? Hearing none, we'll open the vote. Vote is open. Carried. Seven point three, Grand Slam Ballpark Rebuild Update, verbal presentation. Thank you.
Thank you, Deputy Mayor and City Council. I'm going to turn this over to Dwayne Kripp, President of Prince Albert Minor Baseball, to give this update. I just want to take a quick moment, though, just for everyone's aware. I'm not sure if you are or not, but Dwayne on October 22nd received the Sportsman of the Year award at the 22 Kinsman Raiders Sportsman Dinner. So we just, on behalf of the department, want to congratulate him on that. Once again, Dwayne, President of Minor Baseball, has mentioned, but also has been a key figure and a key partner on where this project is at this time. So congratulations to you on that, Dwayne.
Great introduction. Thank you.
Thank you very much. I'll be brief. I know it's a long evening. Quick update on the phase 2. We're at now 85% of our completion where we want to be for 100%. And right now we're looking at our, excuse me. Right now we're sitting at, with our 15U diamond being pretty much complete and ready for gameplay. The only thing we need there is to do the dugouts. Sorry. Oh, I'm good. No, I'm good. We've been sitting there drying out. Yeah, so the only thing that we have on diamond number 2, which is Lipchuk Field, is the dugouts that we still need to do the concrete floors on that. Diamond number 1 is complete, and only thing we need there is concrete floors in the dugouts. And on diamond number 3, what we still need to do there is the complete of the enclosed dugouts. We'll be doing that work this coming spring. The next part, which will be a spring update, will be with the batting cages, and we should be ready to go with that as soon as the snow goes. We've got the design all set up to go, and as soon as the snow goes, we'll have our contract go in and do that. So overall, the project has come along really well. We're excited about getting in there and getting the play going May 1st. And the other update, for what this ball diamond has already been doing for us, for this community, is we had 3 tournaments with the 13Us, and we had over 20 teams come in to Prince Albert to play ball, in this past year. On the go forward, we hope to host, we'll be putting in a bid to host provincials this coming summer. So that will be another huge boost into our local economy. The other part that we will be proceeding with in the springtime will be moving into phase 2, which will be scoreboards. So that'll be the next part. Overall, the community support has been absolutely phenomenal in the sponsorships that we've been able to get in to allow us to do this project. I really thank the city council for supporting the project, and we're really excited about what this next ball season is going to bring as we get into the next phase of the project. So thank you very much.
Thank you very much. Any discussion? Any motion? Councillor Edwards.
I'll move the recommendation.
Thank you. I really appreciate the presentation and that you were here for it, so thank you so much. No further discussion. We will move to the vote. Vote is open. Carried. Vote is closed. 7.4, Carlton Park Community Club Pave the Way fundraiser update. Verbal presentation.
Oh.
Thank you.
Thank you again, Deputy Mayor and City Council. On behalf of the Department of Community Services, we just wanted to provide City Council with one final update in 2022 on the Carlton Park Community Club Pave the Way project, which has been a great addition to the city and definitely to the Carlton Park community. This project was approved in 2022 budget through the Parks Playground Improvement Budget, along with the Carlton Park Community Club agreeing to raise funds through naming rights, fundraising, and sponsorship. This project started in July, and now I can say we are fully complete in paving of the outdoor rink, installation of puckboard and netting, and further completing is the installation of the 4 outdoor basketball poles with backboards, rims, and nets, along with the addition of 3 pickleball courts. Just as an update, we did hold off on a few minor items, and we did this moving into fall. And knowing the season we're in now with the community club making ice, we just held on a few minor items such as adding of some benches and some garbage cans. We will make sure to complete those in the spring of 2023. As a further update to that, once that is finalized, we'll make sure at that time we do a proper grand opening, making sure we invite members of council, members of the community, media, sponsors, and key user groups of the project. So yeah, that's that update. Lastly, I just mentioned as a community club too, they continue to raise funds part of this project. And so today there is a recommendation to approve another sponsor who has stepped up. Once again, another great business in our community who stepped up to support this project. Thank you.
Thank you very much for the presentation. Any discussion? Councillor Head.
Thank you, Deputy Mayor. I'll move the recommendation.
Thank you. Any further discussion? Councillor Zurikowski.
It's been a while since we've had a community club step up and be involved in a fundraising partnership in this kind of way. And I've certainly heard, you're right, the kids love it over there. They can go shoot hoops now. They're pouring ice already. So what a wonderful addition to our community, because it's yet another venue that our families and kids can go to. So kudos to the community club and to the administration and to all the sponsors to make this happen.
Thank you very much. Any further discussion? Thank you for your work. I'm going to open the vote. Vote is open. We're missing 2 votes. We'll close the vote. Carried. 7.5, Second Avenue Banner Project with a presentation.
Okay, good evening, and thank you, Deputy Mayor and Council, for the opportunity to present the Second Avenue Banner project plan. So the purpose is to implement phase 1 of a banner program that beautifies and highlights our main corridor, Second Avenue, engages local artists, and celebrates the culture, heritage, and natural beauty of our city, promoting positivity and pride. The project addresses goals of both the Municipal Cultural Action Plan, 2 in particular that I won't highlight, but also of the Public Art Policy, 5 in particular, and efforts towards a beautification plan for our city. It was introduced at the MCAP report that was provided to Community Services Advisory Committee and City Council back in September. So the banner project can benefit our city to create a stronger sense of arrival, provide a bright and colorful display of art, showcase and celebrate the culture, heritage, and natural beauty of our city, display and create our city's beautiful natural environment, including park and green space, animals, river, and more, provide local artists with an opportunity to create the designs for the banners, and again, promoting positivity and pride. And these, what you're seeing is just a couple of examples from other communities. I don't recall the one on the left. The one on the right is actually at Watson here in Saskatchewan. In terms of a timeline, we've already done a call out for quotes to 4 different companies. 2 were received back. If this project was approved, we would post an expression of interest or a call for artist banner designs for a deadline of November 29th. Make the selections by December 13th, choosing up to 12 unique designs for 2022, and banners made and delivered by the end of this year. Installation would happen in 2023, also with MCAP funding is what we're recommending. The banner design themes, and sorry, these are just a few examples I recently saw on a little trip to Edmonton, so a little bit different concept with the mesh and even less of the design in terms of the metal cutout. So the banner design theme that we would provide the artists is to celebrate the culture, heritage, and natural beauty of our city, and celebrating our wonderful natural environment, our parks and our green spaces, animals, rivers, and everything beautiful in and around our city. The banner locations, you're probably not going to be able to see this on the slide, but we're looking at 2nd Avenue West, the south entrance to the city, light poles on both sides of the street from Marquis Road to approximately 34th Street. The banner specifications, I won't get into too much detail, but we're looking at 24 inches wide by 60 inches high, an original concept with the bottom 4 inches for the city's logo. The material would be aluminum, 3/16 inch. It has a good lifespan. We're looking at 5 to 10 years. They're approximately 26 pounds, and I'll note that we've ensured that we fall in the SaskPower specifications. Powder coated with a finish in either green, red, blue, or yellow based on the designs, and 30 to 50% of the cutout of the design with relatively simple designs. The project budget is for 2022, $12,320. So the recommendation I believe I have is to go up to $14,000 maximum. And then in 2023, as I mentioned, would be the installation costs of approximately $2,600. Thank you.
Thank you very much. Councillor Edwards.
Oh, thanks, Judy, for the presentation. I really like the idea. I think it's positive for our city. I think it's going to help beautify our city, as you mentioned. I like the locations. I think the price is worth it, and I'll move the recommendation.
Thank you. Any other discussion? I have a question. Is the intention to have the banner to be able to fly fabric or anything, or just to maintain a static metal banner?
Right, yeah, the banner itself is aluminum, sorry, and then with brackets holding it. And again, with the amount of cutout for the wind to be able to transfer through, right, we've worked that out with SAS Power and other communities. And like I said, this new design that I saw is even more, allows for more wind to go through.
Thank you. Councillor Zurikowski.
Thanks, Judy, for your presentation. A couple of questions, if I may, that I was asked I didn't know the answer to. You anticipate these banners would stay up for how long, more or less?
5 to 10 years.
5 to 10 years. And with over that time span, we could handle the maintenance that may be required. If they get broken, we can take it down, replace them. We have that capacity.
Within that time, we don't anticipate much maintenance, to be totally honest. The best quote of the two quotes we received was Metalman, and we have conversed back and forth. And he, provided that range of 5 to 10 years, and kind of based on other communities, like Watson's went up quite a few years ago. So I don't think we shouldn't expect
And that's
maintenance
why it's
in
nice
between.
to stay away from the vinyl or the
Correct.
plastic. Yeah.
If you look at SAS Polytex
Right.
on 15th, they didn't last very long.
Good. Okay, thank you for that. The only other thought I have, and I know it's a little outside this bubble, but I think if we're going to go through an expense like this, and it's a nominal amount, I get that, but we want to make sure that everything below those banners are, as much as we can, fall into, are we doing everything we can as a city to beautify that area as well? So I know I'm going to be watching to make sure, and one of the frustrations I have is that I looked at the map, the location, it's going to go right next to that billboard, next to a hotel on 2nd Avenue on the east side that is empty, that has nothing on it, but falls outside of our bylaw for us to do anything about it. So I think those are the big little issues that the public pay attention to. We're making all this effort to beautify our city, and that there's some things that we sort of either aren't able to enforce or with our capacity issues or outside of our authority. But thank you for the work that you do, and thank you for bringing this forward.
Thank you. See no further discussion. We'll open the vote. Vote is open. Carried. Accepted. 7.6, 2023 waiving of fees requests with a verbal presentation. Go ahead, Director.
Thank you, Madam Chair. We did put out the annual call for applications for our waiving of fees as per our waiving of fees and in-kind support policy. That process was completed in September, which then also gave us time to adjudicate each of those applications and prepare this information for members of council. You will see in the report that we have 15 different events that we're recommending be supported in 2023. We all but one, we had the Pride Parade and Community Fair. We're just confirming some aspects of that currently with the organizers, but the rest we did receive final applications. This helps not just community services, but also Public Works and the event hosts themselves plan well in advance. As council will recall, there was a time prior to having this process in place where a lot of the events would come directly to council on one-off occasions, which gave fairly short windows of time to make decisions, but also for the planning to be put into place. So we do feel this more proactive approach has really benefited city resources, but also the event hosts themselves. For the benefit of council too, we do have the dates also in the report for each of the events, so they're scheduled well in advance as well. That helps us with promotional purposes. And lastly, I would add, we make it a condition, should these be supported, that the City of Prince Albert needs to be recognized as one of the major sponsors. So it's very important to recognize the resources that are going towards the hosting of the event. A big part of that are the city resources that are put into place. Therefore, we do ask for that recognition alongside their other sponsors from the community. So with that, I would open up to any questions.
Thank you. Mayor Dion.
Move the recommendation.
Any further discussion? I just had a question. Are there entities that requested for waiving of fees that the department has declined?
Not for 2023. No.
Okay. Thank you. Seeing no further questions, I'll open the vote. Vote is open. Carried. 7.7 Lead Services Replacement Program. Okay, so are we having we are having a presentation on this? Oh. Okay. Go ahead, Director.
Thank you. So the senior account manager and the director of finance services could not be here this evening. So you get me. I had to be batter up. I'll try to be as brief as possible. You've seen this topic. Lead services, yes. He's here to support. It was a financial services presentation. You can if you want, I guess.
That I mean, we would hear a motion if someone had a motion on that, or we could hear it tonight. Okay, we will start with the presentation.
Okay. You got it? All right, next slide, please. So that's just to explain the lead service connection and where the property line is. Next slide, please. So basically what we have here is the situation where the lead services can leach lead into the water system. And I want to reiterate, we do not have lead in the water that we deliver to the residents. It's in the service connection on their private property. Whenever we do a new street, we always remove every lead service that we find, but only up to the property line. Next. So as you can see, the green square is the part that we replace whenever we encounter them. The yellow square is the part that the homeowner needs to replace. And then there's also what's inside the house. Next. The challenges are that we did have an incentive program back in 2010. We had very low participation. Only 12 people over 3 years participated in the program. We financed $2,000 towards each of those homes. The database, we're down to 460 according to our database, but we're always finding errors in that database because it does date back to the beginning of the city of Prince Albert. We find that about 10% of the ones that we think have lead service connections, when we actually dig, they're not lead, they've already been replaced. But contrary to that, we also find when we're digging a street, sometimes you encounter lead services that are not on the list. The recommendation here is to have mandatory replacement program consistent with other municipalities. That's in the report. To replace replacements to occur at the same time that the city does ours, and to defer payment plan, make that available. So basically in the financial recommendations, next slide, is it's going to cost between $4,000 and $7,000 for the private portion of a house. Now that's a today cost. That will rise as time passes. There's about 460 left to go. When you do the math, it's between $1.8 and $3.2 million for the private side of all the residents that are left. It's a very large number overall. Next slide. Financial implications, though, as if we spread that over 7 years for that individual, they would get into an agreement like you would with a local improvement. If you were going to pave a street that is gravel, that's a local improvement. If we're going to have residents change their side, this would be considered a local improvement. We would put it against their taxes, and then they could pay it over a course of 7 years. They would be, in essence, the water fund is lending cash to pay for the work and then recovering it through their taxes. Next slide. A deferment payment is proposed right there. If it was over 7 years and that service cost $4,000, you'd be looking at a monthly payment of $48. If that service costs $7,000, you'd be looking at a monthly payment of $83 over 7 years. And at the end of the 7 years, that's removed from your taxes. That's what local improvement is. Any questions?
Seeing none. Councillor Zurkowski.
Wes, does this include the pipe that goes from the box of service connection to the house?
That's what we're talking about.
That's what
So
we're talking
the city portion would still take place. We do that. It's on the city of Prince Albert. But from that curb box, you know, just past the sidewalk to inside the house where it comes up into the house and goes into the meter, that's the private connection. We don't have very many takers in the past because it is an expensive process. Other cities do force residents to do it. It's not optional for them.
There's only a couple of contractors in the city that does this work.
We do have a couple of contractors that do that work. And as noted in the report, there's two different ways of doing that. There's open cut, which is more expensive. There's pulling a new pipe through. It's directional, not drilling, but directional pulling. And you ram it up where the old pipe went. It's usually successful, but if it fails, then you have to excavate.
Yeah, I've seen that last summer. So, my other question is, so this is only when the city is going to do work anyway?
That's what we're proposing at the moment here. Okay. Now, it wouldn't preclude any resident from coming to us and saying, I'd like to do mine, because we do also have a program where we do replace individual lead services in addition to when we're doing entire streets, when we're replacing water mains. And we do a few of those every year, but we do our portion, and then the resident would have to do their portion.
So
that would be included in this.
Right, so somebody buys a house, oh my gosh, I found out I have a lead pipe, want to get it replaced, they can come to the city for some sort of put it on my taxes, and I'll get the work done.
Correct.
Perfect, thank you.
Thank you. Councillor Head.
Thank you, Deputy Mayor, and thanks for this report. During the dig on 12th Street, I heard from a lot of residents, and you mentioned that in the report, that, you know, what are we doing as a city to, you know, to ensure that we are replacing all lead services now? You know, this policy would capture that. I like some of the options you brought forward. I do feel that we have a heck of a lot more than 460, and you raised a good point, Councillor Zurkowski, is it when we're just going by the house and then we're going to replace it? So that should be, you know, spoken to versus, you know, everybody with a lead service in the city has to replace it now. That's not what our intentions are, I would think, with this bylaw, is that if we're there digging up the street, you know, it'd be beneficial for the resident to change as well. I do like the number of a cap at 4,000. I like it deferred over 7 years. So if you're looking at that, I'm just providing some comments. Looking at some of the different variations throughout our province here, I think this is important that we move forward on this. So thanks for the report.
Mayor Dion.
I take it you pass this towards legal. So I'm a 75-year-old person living in a fixed income in my little house, and I can't afford that $83, and I don't want it. Can we legally force it on them?
Under the Cities Act, yes, you can. It's done in other cities, not just for this kind of thing, but other cities actually charge for replacement of water mains and sewer mains, replacement of sidewalks. They do local levies, and they're voted in by council, and they're forced. And it goes on your taxes regardless of your personal situation. Now, other cities might have 5 or 10 years. We're proposing 7 years.
So if I say no, so we're going to bring our crews in and go from the street then to their house and do the connection to the house and then bill them for it?
Well, it would be a contractor, but that's what has been suggested here. Regina, Moose Jaw, and Saskatoon, it's mandatory. So you can plead to council, yeah.
As long as we can send the sheriff in,
Yeah.
because I'm not going to force anyone.
But apparently that's what they're doing. And if you don't want to do that, we don't have to do it. This is a suggestion. It was brought forth.
Councillor Ogrodnik.
Thank you, Deputy Mayor. I'm not comfortable forcing people to do this at anywhere from $4,000 to $7,000 and going up, as you said. I just don't think that that's right. If somebody wants that pipe as lead, then that's the way it is. So I'm voting no.
Any further discussion? Just my comment is that it is a safety, a health issue as provided in the report. No further discussion? I'll open the vote. Oh, yes? Go ahead, Councillor Head.
Thank you, Deputy Mayor. Just reading the motion again. When do we expect to see this report? Because, you know, I imagine we're going to get a lot of feedback from the residents, and I would like to have a date on when we can expect that, I guess, this bylaw.
Well, I guess there's only one more council meeting this year. So if you're looking for this to be implemented in the new fiscal year, I guess during budget deliberations, I guess this would come to the next meeting if it's passed in its entirety, and I guess you guys would decide if you want it to be implemented in 2023 or at a later date.
I think it should come to another executive meeting to have some more discussion about what the policy looks like. But because right now we don't see what it is, it's just it's kind of an idea in principle, but we'd like to see what that looks like.
Yes.
And come back to executive. Yeah.
Mayor Dion.
Well, to comment back to what the deputy mayor said, yeah, but you can make it a health issue. The bottom line is we can only replace from here to the house. And I've got 150 feet of lead pipe in my house to all my washrooms, to my sinks. So that's why I say, yes, but I'm the old person that does want to change, and I have that lead in my house. And granted, it's a safety issue in your opinion. As a senior, I've been drinking this water for 70 years, and it hasn't killed me yet. You know, and the problem that I have is I have a problem replacing 20 feet of lead pipe when I know there's 100 feet on the other side. So we're giving a false thing. They've still got lead in their water, even though we've replaced what you can see on the street.
You are correct, because if they have a very old home and they haven't replaced any of the piping in the house, they still have lead. There's not as many of those, but they still exist.
Thank you. Any further discussion? Hearing none, I'll open the vote. Vote is open. Waiting for one vote. There we are. Carried. 7.9, SUMA.
Thank you, Deputy Mayor and Council. I'm here to provide an update to you on the International Property Tax Institute report that was provided to Saskatchewan Urban Municipalities Association. So administration has done a review of this report to provide you with what the impacts would be to our city of Prince Albert based on the recommendations that were provided. So in 2021, we saw some significant changes with assessments. There was some shifting that went on. And through those concerns, those were brought to SUMA for consideration of some legislation changes. So SUMA engaged in IPTI to conduct a review of the assessment and taxation system. So they provided a number of changes, recommendations, and so the first one is to move to true market value system, and this would be the biggest change. So to move to a true market system, it would require all of the options to be considered, and this would take significant time, as there will be great changes that will have to be made to legislation and manuals, handbooks to occur. The second option is to move agricultural property out of regulation, so it follows a manual that is law, and it is based on rates and everything that is determined that basically they're valued on a provincial average. And moving them out of regulation means that they will be more reflective of the market within their area. So that will have a great major impact to agricultural taxpayers. Remove the provincial percentage of value is the third option. So this is not much, this wouldn't be much of a financial impact to the city. This is more, requires more time for review from administration. So it would remove the percentages of value that is in the city's regulations, where an example is commercial property got changed for 2021 reval. Instead of paying on 100% of their assessed value, they're paying on 85% of their assessed value. Residential is 80% and so forth. So that would be removed, which would lead to less complication in the calculation that people see for their taxes. Shortening, number 4, shortening the current 4-year revaluation cycle. So this one would have a financial impact to the city. They do recommend in the report to move to an annual revaluation, but that would be a significant change all at once. So they do say that shortening the revaluation from a 4-year to a 2-year to introduce a lot of the changes would help support more of a frequent revaluation. So this one would really require additional staff in assessment for this to actually occur, as there would be more work needing to be done in a shorter amount of time. And option number 5, to change the base date, would also be a financial impact to the city of needing more additional staff as well, as it's a shorter period of time. So right now, we have a 2-year gap. When we delivered values in 2021, they reflected a base date of January 1, 2019, and they're recommending that that be shortened. So the base date would be reflective of closer to the time frame of what values you deliver. So they're recommending about 12 months. They also are recommending as option 6 to change the assessment taxation timetable. Their outline is included in the report, and it will impact when tax tools get set, when budget gets set, and everything like that, the outline that they've provided. This causes a large impact to the city with timelines of everything. So it causes a lot of higher potential risk with that being able to happen. We don't know what the appeal risk is, as everything and tax tools are all set prior to all the assessment appeals coming in. Option 7 is to reform the appeal system. They're looking at the timeline of when assessment notices are sent out and the timeline of when appeals can be made. In a revaluation year, you have 60 days from the date that your assessment notice is mailed. In a non-reval year, you have 30 days. So this will tighten up more. It's not much of a financial impact, it's more of a time frame impact. Legislation also does indicate we have to have decisions from the Board of Revision back within 180 days. So the longer the time the roll is open, the shorter time it gets us to be able to get the appeal work done, which is very time-consuming work on assessments end. Also within, after discussions with the Secretary of the Board of Revision, a lot of the appeals that come in at the very last moment tend to be tax agent appeals, which those represent more commercial, higher value commercial properties is who a lot of the tax agents represent. Number 8 is for training. So with any of these changes that do occur, there will be the need for additional training to policymakers, so educating council on what's changing and why and everything, as well as staff and stakeholders and the public as well. So we would have to work on, as things are being brought out and implemented, making sure everybody is well educated and informed of the implications and what's going to happen. Thank you.
Discussion. Councillor Kilmer.
I'll move the recommendation.
Any further discussion? Hearing none, I'll open the vote. Vote is open. Carried. Unfinished business, we have none. Do we have a motion to adjourn? All those in favor? Aye. Carried. I propose 30 minutes, so 8:45.